All right, good morning, everyone. I think we'll get things started. It's 10 a.m. I'd like to call the Law Amendments Committee for March 25th, 2023 to order. Welcome everybody here to Province House in the Red Room. My name's Brad Johns. I am the MLA for Sackville-Uniacke. I will be chairing most of today's meeting. MLA Ritzy will be taking over around 12 o'clock or so. Before we get things underway, I'd like to provide the members that are here for the committee to identify themselves for the record, and I'll start with the government members with MLA Taggart, please.
Good morning and welcome everyone. Tom Taggart, MLA for Colchester North.
Good morning, everyone. I'm Barbara Adams, the MLA for Eastern Passage.
Good morning, Pat Dunn, MLA, Pictou Centre.
Good morning, everyone. Johnny McDonald, MLA for Hants East.
Good morning, everyone. My name is Kelly Regan. I'm the MLA for Bedford Basin.
Good morning, everybody. I'm Braden Clark, MLA for Bedford South.
Hi, Gary Burrell, Halifax Chebucto.
Hi, I'm Lisa Lachance, MLA for Halifax Citadel Sable Island.
Thank you, everyone. And I'd also like to recognize Ledge Council with us today. To my right is Gordon Hebb, and to my left is Killian Schlimler, which I always say wrong, and I apologize, but why break the trend now? Before we get going, I'd also like to run down some of the rules for the members and for any presenters. I would like to ask everyone if they could please turn their cell phones off now or put them on vibrate. Remind everyone who may be attending in the audience to please always be respectful. We do not allow any shouting, cheering, whether for or against anything that is discussed here, and we continuously ask for good behavior. If there is any disorderly behavior, you'll be asked to leave and we'll take a recess. I'd like to remind everyone that there's to be no taking of pictures or video by anyone other than the accredited media, and that presenters are asked to please not use props of any kind. Copies of all written submissions on the bill have been received by email up to the time when the bill is reported back to the House or in person during a Law Amendments Committee meeting, will be given to the library staff and will be posted online. Submissions received after a bill has been reported back to the House are distributed electronically to Law Amendments Committee members, but are not posted online. The agenda for today, listing the order in which presenters will be invited to speak, is available for viewing on a small table to the left of the door when you come in. I would note for members that we do have a revised agenda, which Council has just passed out to everyone. For scheduling purposes, all presenters today were required to provide prior notification to the Legislative Council office that they would be speaking on all the bills, so we will be proceeding from a list provided. When your name is called, please come forward, state your name, how you would like the committee to address you, and the organizations, if any, that you represent. Once again, in order to allow all scheduled speakers an opportunity to speak at a reasonable time, we will be keeping track of time. You will each be provided a set time to make your presentation, followed by receiving and answering questions from members of the committee for up to 5 minutes. I will alert you when there is 1 minute left to speak. Regarding presentation time, if we have 8 or less presenters on a particular bill, each speaker has up to 15 minutes total time. Typically, this is 10 minutes to present and then 5 minutes for questions from committee members if they have any, for a maximum time of 15 minutes per presenter. I would note once again that each member will be allowed 1 question without any initial follow-up. Once all those who wish to speak have had a chance to ask 1 question, I will go back if there is a second question from any members. Once we conclude the 8th speaker on a particular bill, presenters 9 and forward will have 5 minutes to present, with 5 minutes for questions, for a total of 10 minutes per presenter. If presenters have handouts for the committee members, please make sure that you provide them to the pages for distribution. And I'd like to remind everyone, presenters and members, that you need to be recognized by the chair before you speak so that the mics can be on and your comments will be captured for the record. With that, our first order of business today, we do have a change sheet that is before us. And I would go and recognize MLA McDonald, please, to move these.
Thank you, Mr. Chair. I believe the proper process I'll ask for you is I'll read the change sheet and then do the move. I think I do it in that order. Mr. Chair, thank you. So, Mr. Chair, everybody, all the members here have a copy of LAC Gov 1, and its changes recommended for the law amendments for Bill 419, Financial Measures Act. Pages 32 to 34, Schedule A, delete. Page 34, Schedule B, heading, delete B. So, Mr. Chair, as I know you're aware, government was working on putting this in place in the legislature. And last year, the wildfires taught us that we need all the resources possible. This legislation was to ensure that professional firefighters could volunteer in their time off. The Department of Labor Skills and Immigration are going to do some consultation while we pause this, so that's why the reason of taking it out, because we want to get this right for all the firefighters and everyone. So thank you, Mr. Chair. And I move the amendment LAC.
So we do have a motion in front of us. All those in favor signify aye. Aye. Nay. Those against, nay. Thank you very much. And I think that's it, is it? Yep. Perfect. So we'll move on to our agenda now and our speakers. So I would remind everybody, I'm looking at the list very quickly and I think we're okay, but if there is anyone here in regards to the amendments that were before us in regards to fire, that those have now been removed. If you are here to speak on that, if you would like to, you're still welcome to. If you don't want to, you're welcome to not. Starting off with our first presenter this morning, Duncan Robertson, please. Good morning, sir.
Morning.
I apologize to you and anyone else who I may say their name wrong as we move forward. But I would like to ask if you could please identify yourself for the members, as well as how you would like to be addressed by the committee, and if you are here representing any particular organization, if you could identify that as well. And then after you've done that, I'll start your 15 minutes.
Thank you. Duncan Robertson. I use he, him pronouns, and I'm representing the Canadian Federation of Independent Business.
Okay. Whenever you're ready.
Perfect. Well, Mr. Chair, members of the committee, thank you for allowing me to join you today to speak on Bill 419, the Financial Measures Act. As I've stated previously, my name is Duncan Robertson, a senior policy analyst at the Canadian Federation of Independent Business, or CFIB, and I'm based here in Halifax, Nova Scotia. Before I begin, some background on CFIB. We're Canada's largest non-for-profit organization devoted solely to the needs of small businesses. We are nonpartisan and deal with all sectors and all regions across Canada. We have 97,000 members nationwide, 4,000 of whom are based here in Nova Scotia. Now, while there are several measures in Bill 419 that we support, such as indexing tax brackets to and basic personal amount to inflation, harsher penalties for illegal activity in the fisheries sector, extending business tax credits, and extending the mandate of the Executive Panel on Housing in the HRM, which received a one to watch as part of our 2023 Golden Scissors Award. We believe that if you look at this bill solely through the eyes of a small business owner, there is room for improvement, particularly on the tax side of this bill. There are a handful of amendments which I'll propose today that could strengthen Bill 419 and make a tangible difference for small businesses. Now, I think we can all agree that small businesses provide a substantial amount to our communities. They grow our Main Street, donate to local charities and causes, sponsor events, and are often the places where the youth of our province find their first jobs. Yet, many of our province's small businesses are still trying to recover from the pandemic and having gone from the shutdowns of COVID right into the current economic difficulties we're all facing today. For all they do for our community, small businesses deserve a chance to catch their breath. According to CFIB's February Your Voice survey, the financial situation of their business and the cost of taxes are the biggest challenges for small business owners across Nova Scotia. Specifically in terms of taxation, 3/4 of our members in the province have stated that tax costs have a serious impact on their business. For some context, small businesses in Nova Scotia and businesses in general pay the 3rd highest payroll tax burden in the country, so there is some need to provide some support, I believe, and that can be created through this bill focusing on the tax side of things as well. But unfortunately, Bill 419, as well as Budget 2024-2025, lack targeted tax measures specifically for our province's small businesses. However, through the law amendments process, you, the members of the Law Amendments Committee, have the opportunity to deliver for Nova Scotia small businesses. We believe that through this committee, all parties can unite in addressing the impact the current tax environment is having on small businesses by amending Bill 419 to include the following. First, reducing the small business tax rate, also known as the lower rate of the provincial corporate income tax, from 2.5% to 2%, with a plan to bring it to the national average of 1.75%. Number two, increase the income threshold or the business limit for the small business rate from $500,000 to $700,000 and index this amount to inflation. And finally, cut the provincial fuel tax to provide much needed relief to small businesses and consumers, as we've seen in provinces like Manitoba and Ontario. We believe that these amendments are a pragmatic and cost-effective way to give small businesses the environment they need to catch up, keep up, and hopefully get ahead. In addition, the savings these measures would provide would benefit small businesses and their employees alike. When surveyed, 2/3 of small businesses in Nova Scotia said that they would use savings from these measures to first pay down debt, particularly that CEBA debt, which is incredibly sticky and hard to get off a lot of small businesses' plates, many of whom have seen that CEBA debt rise substantially. And then second, close to 6 in 10 small businesses would use these savings to improve employees' wages and benefits, thereby enhancing the employer's ability to attract and retain labor. You know, whether it's a farm in Pictou County or a family restaurant in Bedford or a small brewery in the Halifax Peninsula, the proposed amendments for Bill 419 that we are putting forward could provide meaningful support for small businesses across our province. With that, we hope our members' views and these recommendations will provide your committee with the necessary insights as you consider other amendments suggested by the public, and I'm happy to take any questions you may have.
Thank you very much for your presentation. Just quickly, I'm wondering if you have handouts for the committee or not?
No, but I can provide my written statement to the clerk. Yep.
All right, we'll go to members of the committee for any questions for 5 minutes. Do we have any questions? If not, thank you so very much for your presentation today. Have a wonderful day.
Bye.
Moving on to our second presenter today, Nancy McCready-Williams. Good morning. Welcome. So as with the previous speaker, I'll provide you both with an opportunity to introduce yourselves quickly. And once you've concluded that, we'll start your time. You can just identify how you would like to be addressed and if you're here representing any organizations for the record, and then we'll start your time.
Good morning. My name is Nancy McCready-Williams. I'm CEO with Doctors Nova Scotia. Please refer to she and her. I'd like to introduce my colleague, Dr. Colin O'Dane, who's president of Doctors Nova Scotia, who will be providing our remarks this morning.
Wonderful. Thank you very much. And whenever you're ready, I'll start your 10 minutes.
Members of the Law Amendments Committee, thank you for the opportunity to present on the amendments to the Privacy and Health Information Act tabled under Bill 419, the Financial Measures Act 2024. I am Colin O'Dane. I'm the president of Doctors Nova Scotia. I'm a practicing anesthesiologist located in Halifax. And as Nancy mentioned, I am joined by her. She's the CEO of Doctors Nova Scotia. Doctors Nova Scotia represents more than 3,500 members, including practicing and retired physicians, as well as medical learners. Our purpose is to help physicians thrive, to help physicians to thrive and have a positive impact in our patients' lives at an individual and system level. I want to start by commending the government on their commitment to giving patients better access to health information. Doctors Nova Scotia is supportive of this initiative as it gives patients more autonomy in the management of their health and supports better health care. I understand that the proposed amendments will allow the government to make regulations under PHIA that would require physicians as custodians to disclose patients' personal health information to the Minister of Health and Wellness for the purposes of planning and managing the health system, resource allocation, and creating or maintaining electronic health records, programs, and services. Doctors Nova Scotia understands that the purpose of these proposed amendments is to improve Nova Scotians' access to their health information through an e-health initiative such as the recently piloted Your Health Nova Scotia app. We are supportive of patients having better access to their health information. Physicians are concerned about how the information could be used by government and for what purpose. As physicians, we're responsible for protecting patients' health information and the confidentiality inherent in the therapeutic relationship between a patient and the physician. I've had an opportunity to share these concerns with the Premier and senior government officials. After several conversations, we've been able to agree on a path forward that will address these concerns and help ensure physicians and patients are protected under the government's leadership. The Premier and senior government officials have committed to working with Doctors Nova Scotia to establish a data governance framework that will provide a formal commitment outlining the parameters for the collection, use, disclosure, retention, and disposal of information extracted from physicians' EMRs for the purposes of Your Health Nova Scotia app. In addition, government is committed to creating a standing committee on data governance to oversee data governance for this initiative and future innovations. At this time, we believe government's expressed plan for accessing patient information is well-intentioned, and we feel through adequate safeguards we can protect the confidentiality inherent in the therapeutic relationship between a physician and patients. So this may leave you wondering why we've taken the time to be here today to speak about the proposed changes. Although we're confident in this government's intentions, we recognize that the legislative changes will have an impact for decades to come. And while we support putting patient health information directly into patients' hands, we are concerned with the broad nature of the legislation and the authority it provides the minister and every minister thereafter to make regulations that may or may not include the safeguards we plan to have in place through our governance framework and standing committee that has been agreed to. So we would like to see greater protection within the legislation to ensure the legacy of this government's intentions and the safeguards that will be in place will be honored in the future. So what we would ask for is a minor change to the bill where it says requiring custodians and classes of custodians to disclose personal health information to the minister or a person acting on behalf of the minister for the purposes of planning and management of the healthcare system, resource allocation, and creating or maintaining electronic health record programs and services when the requirements are consistent with terms negotiated with affected custodian professional associations. This change would allow the good intentions of this government to be honored by those governments who will succeed them in the decades to come. Thank you for the opportunity to present today. Consistent with the spirit of change, the government's intentions and commitments, I hope this committee will recommend this change.
Thank you very much. Ms. McCurdy, did you have, no? Okay, well, thank you both very much for your comments. I'll open the floor now to members, and I have MLA Lachance first, please.
Great, and thank you so much for, this sounds like the work you've done getting here and speaking to government, and then also presenting today. I mean, my question was going to be, sort of what approaches could we put in legislation that would guarantee the safety of people's information? And you've suggested one amendment. I'm also wondering, I mean, in terms of like a standing committee on data governance or referencing the data governance framework, would those be other amendments that you would recommend?
Recognize the speaker, please.
Is that for me? I think that the legislation, if changed to the amendment, the data governance committee would involve the various groups that represent the custodians of the data. So I think it would be a part of that.
Thank you. Recognize MLA Regan, please.
Dr. O'Dane, Ms. McCready-Williams, lovely to see you again. Just wondering, did the government consult with you before they brought in this piece of legislation about this particular issue?
Recognize Ms. McCready-Williams, please.
Yes, they did. So recognizing that the significant shift in this legislation really turns around making the sharing of personal health information in a physician's EMR mandatory as opposed to discretionary. And so government, recognizing the significance of that change, reached out to us before Christmas and started the discussions about the desire to put patient information in patients' hands, which we completely support, and the legal framework around that. And so we've been in conversation with government for the last, certainly since early December, on this issue, and talked about different ways of put in terms of the legal foundation for this. And there have been different options that have been discussed, and we're quite comfortable with where we've landed in terms of the amendment supported by a data governance framework and a standing committee that will oversee not just the use of data for this particular initiative in the Your Health NS app, but also any future innovations that involve extracting data from physicians' EMRs.
Thank you very much. I'll recognize MLA Taggart, please.
Thank you very much, Chair, and thanks, folks, for coming in. I just, everybody's concerned certainly about any data, whether it's a breach of data, whether it's medical or otherwise, but as custodians of the data, I'm sure that you have a very robust protection of anti-whatever and anti-spam or not anti-spam, but protection of the data. So. But it is possible that the data could be, could be stolen, as has happened, from other governments and private industry throughout the world. Why the concern? Do you believe that the government wouldn't have as equal a security on, the Minister of Health wouldn't have equal security on that data when they receive it for whatever purpose they're using it for? Is there a concern there? It could be breached just as easily in your office as it could in a government office. Am I correct about that, or is there something I'm missing?
Recognize Dr. O'Dane, please.
My answer to that would be that any time someone's, I guess it's never 100% safe. You can only do the best you can do. I would assume that the government's strategies are as robust as anybody's. I guess the more places the data is stored, the more opportunities there are to breach it. But I think our underlying concern is not so much about the likelihood that the data will breach, but it's more about the relationship between the physician and the patient. Patients, when they go see a physician, assume that there's going to be confidentiality between themselves and their physician. And we're worried that if there is an opportunity for someone outside that relationship to have access to the data, the minister or their delegate, that this may prevent people from seeking care because they're not confident that other people will see their data.
Thank you. So you only used 5 minutes for your presentation. There are a number of questions. We're at 5 minutes for questions, but I am going to allow the additional 5 minutes for their full 15 for questions, since we have a few, if members are okay with that. And I'll recognize MLA Adams, please.
Thanks. I just wanted to thank you all for being here today, and just wondered, in the letter that you had written to the physicians in the province, it said, well, I know you may be concerned that these changes risk giving the minister unrestricted access to physicians' EMR data. The good news is that the government has committed to working with us to address that risk and the concerns of physicians in Nova Scotia, and you referenced the data governance framework. So my understanding is that the protections that you're looking for are going to be brought forward with the data governance framework. Is that correct?
Recognize. I'm sorry. I just raise your hand so I know which one wants it. Dr. O'Dane, please.
Yes, so that is correct. And to sort of elaborate on what I just said, is that the data governance framework will just provide transparency so everybody is clear on what information is being collected and what information and is available and what information is not being accessed in the electronic medical record.
Thank you. MLA Burrow, please.
I just wanted to ask if you have your proposed amendment in writing, perhaps we could get the page to copy it so all members of the committee could have it? We do have it?
It's on the back side.
Oh, I see. Okay, thank you. Yeah.
Thank you. Going back to second questions now, I would recognize MLA LaChance, please. She's passed. Moving on to MLA Regan, please.
Thank you. So I was just wondering, in terms of, I've been hearing about efforts to reduce red tape for physicians, which I think we all want to see happen. Does this impose a further obligation on doctors? Is this automatic? Like, I'm not clear on how this requirement plays out in a doctor's office. So I was just wondering if you could answer that.
Recognize Ms. McCready-Williams, please.
As I understand it, there will be agreements with the EMR providers. There are two in the province, TELUS and Accuro, and that the access to the EMR will not be, the onus will not be on the physicians to provide it, but the two vendors who provide electronic medical records in the province, the access will be through some sort of arrangement with them. But we don't have the details on that.
Thank you. MLA Clark.
Thank you, Mr. Chair. Just a quick question. I know I've heard some arguments, some people saying this data exists elsewhere or it already exists in databases that are out there now that government would have access to. So, this kind of change is unnecessary or maybe redundant. I don't know if that's the case or not. I'm just curious what your position is on that particular argument here. Thank you.
Recognize Dr. O'Dane, please.
Well, I think it's our understanding of the data that they're looking for the My Health app is correct, that it is available other places. For example, the information about provider, date of visit, and reason for visit would be also information that would be available through the MSI database, but that they're looking for real-time access to the data, and there is a delay, or at least there can be a potential delay from the time a physician sees a patient and they submit the billing information to MSI. So it wouldn't be as useful for real-time access to that information.
Thank you. Do we have any other questions? If not, I want to thank you both very much for coming forward today and hope you have a great rest of the afternoon. Calling our next presenter, Shelley Whitman, please. And good morning. As previous speakers, I'll allow you to introduce yourself and how you would like to be addressed to the members if you're representing any organizations. And then I'll start your time. You'll have up to 10 minutes to present with 5 minutes follow-up questions from committee members.
Okay. Good morning and thank you. My name is Dr. Shelley Whitman, and I am the Executive Director of the Dallaire Institute for Children, Peace and Security that's based here at Dalhousie University and was founded by retired Lieutenant General Romeo Dallaire.
I'll start your time now. Thank you.
Okay. Good morning and thank you for giving me this opportunity to address all of you within this particular committee on the Financial Measures Act and the proposed Child and Youth Commission is what I'm here for this morning. At the Dallaire Institute, our mission is to prevent the recruitment and use of children in armed violence and to transform cycles of violence. This is rooted in a foundational belief that peace is possible, violence is preventable, and that children must be at the heart of all of our solutions. As the name of our institute suggests, we are focused on prioritizing children in all matters that affect them and to ensure that adults understand this necessity. We know that children are more than just passive victims or beneficiaries of aid, and that to achieve sustainable peace, their perspectives are incredibly important. The creation of a commission for children and youth is a necessary and important step in ensuring that children and youth in Nova Scotia are protected and that their voices and perspectives are heard. It should also help children to be able to understand their own social, political, and economic rights so that they may become better advocates for themselves, but also for other children. In the absence of a federal ministry in Canada, it is the provincial child and youth advocate offices that are responsible for promoting, protecting, and responding to the needs of children and youth. Both New Brunswick and PEI have child and youth advocates. It's high time for Nova Scotia to follow suit. We call ourselves Canada's ocean playground, so let's ensure that that playground prioritizes children finally. The creation of a commission for children and youth here in Nova Scotia demonstrates, hopefully, the province's commitment to improving children's access to rights, to the agency that they should possess, and to their participation and prioritization in all provincial policies. It also demonstrates a willingness to strengthen Canada's implementation of the UN Convention on the Rights of the Child by helping to commit necessary resources and funding to achieve the meaningful participation of children and their respect as full citizens. The way a province invests or fails to invest in the protection, empowerment, and well-being of children is an indicator of how committed that province is to upholding human rights overall. Establishing this commission would also help to prevent violence against children in Nova Scotia. Preventing violence against children is not only the moral thing to do, but it makes good economic sense. There are substantial social and economic costs that are associated with violence against children. In 2022, a consortium of global agencies focused on children came out with a study that illustrated, among other things, that violence against children has economic costs up to 5% of national GDP. Violence against children not only hurts the individual child, but it hampers the economic growth and social development of entire communities. Within Nova Scotia, we have become a welcoming home to many new immigrants and refugees, some that have escaped war, human rights abuses, natural disasters, and poverty. In fact, we also know that recent increases in Nova Scotia's population are desperately needed, as outlined in the Ivany report, and also critical to the sustainment of our future as a province. So our hope is to continue to encourage new migrants to come to Nova Scotia, and that should include being welcoming for children. This critical need to address the unique challenges of children must also bear in mind any traumas they may have endured or their families may have endured prior to their entry into Canada. It is my submission that this new Commission for Children and Youth must make this as one of its priority areas of focus. Personally, I have witnessed children and their families who have originated from all over the world describe some of their challenges integrating into Nova Scotia. It's without a doubt that children have been missing an advocate or a commission that can help decision makers make what we would call child-informed approaches, central to how we allocate our resources and our priorities. For example, in the midst of the Syrian refugee crisis, this province welcomed many families who have been now successful members of our communities. But many communities went to great lengths in this province to fundraise as well as to secure new homes and lives for many. Yet at the same time, many educators I had been in touch with, as well as healthcare providers, explained how they were not prepared at all for this challenge. By creating a Child and Youth Advocate or Commission, Nova Scotia is sending a clear signal that it is investing in children and youth, and that my hope is this commission can be provided not only adequate resources and expertise, but that this legislature view it as a priority that should be cross-cutting across all areas of the Nova Scotia policies and legislation. Investing in children and in this commission is not only the right thing to do, as I said, but it makes good financial sense in the long term. And it's important that the legacy of the recommendations from the Nova Scotia Home for Coloured Children restorative inquiry be actioned to honor the pain that they have endured and to provide hope for all children in Nova Scotia that we will commit to a better future. I thank you for your time this morning.
Thank you so very much for your presentation. We'll now go to members for questions, and we'll start off with MLA LaChance, please.
Hi, thank you so much for being here. I'm wondering, based on your read of what is now actually Schedule A of the FMA, if there are other elements that you think should be included in the legislation.
Recognize the speaker, please.
Sorry, thank you very much. Again, I think in terms of the aspects related to children who are coming from outside of the country, outside of the province, from conflict zones, from disaster areas, I think that that's one key priority that needs to happen. I would also say that I would just really like to make sure that in terms of anything that I would argue that is missing is that it really feels strongly that this commission needs to be more than a commission that's led by adults. It needs to have children who are members of it.
Thank you. I'll go to MLA Regan, please.
I was interested to hear what you were talking about, folks fundraising for Syrians to come in, et cetera, and make sure they had a nice place to live and be supported in that way. But recently, the member for Bedford South and I met with an educator who talked about just sort of the lack of supports in the school system as it exists now, where other provinces do it better. And so I was wondering if you could speak to sort of the kind of thing that you would hope would come out of this commission.
Recognize speaker, please.
Yeah, I think that one of the things that I hope is that when there are decisions being made that have an impact, whether it's on education, healthcare, or prioritization of how we might spend and use resources, that we would be able to ensure that we are looking at it from a child-focused lens. And I think that whether it's through decisions that have made on things such as COVID-19, for example, and others, I would sit back and look at that and say, I don't think anybody looked at that from the perspective of how it's going to impact children. It is always the case that in many governments around the world, let alone provinces in this country, you would see that that seems to be an afterthought as opposed to a priority in first making these decisions on how it's going to impact children.
Thank you very much. Do we have any other questions? Any other questions? If not, thank you so very much for your time today and coming in.
Thanks.
Calling our next speaker, Mark Culligan, please. Good morning. Thank you for coming to Province House this morning. I know you were there earlier, so you heard me say this before, but you'll have up to 10 minutes to make a presentation, followed by 5 minutes from questions from committee members. If you can introduce yourself and if you're here representing any organizations and how you would like to be addressed, and then I'll start your 10 minutes.
Thank you so much. My name is Mark Culligan, and I'm a community legal worker from the Dalhousie Legal Aid Service, and I'll be making my representation today in that capacity.
Whenever you're ready.
Thank you. I'm here to present to the Law Reform Committee on the impact of the Financial Measures Act on income assistance recipients. And I'm thinking about that impact in two ways. So one is the lack of indexation of income assistance benefits, and the other is the impact of the implementation of the Income Assistance Disability Supplement. Turning first to the income assistance and indexation, there's been a long-standing demand on behalf of human rights and anti-poverty advocates to index income assistance in accordance with the rate of inflation. And it's important to understand this, the importance of this indexation demand within the context of the overall inadequacy of income assistance in this province. The primary purpose of the Employment Support and Income Assistance Act is to provide assistance for persons in need, and in particular to facilitate their movement towards independence and self-sufficiency. And the Income Assistance Act defines assistance in three basic categories, the first of which is basic needs assistance, which is supposed to provide assistance for money, goods, and other services to a person in need to assist them with the cost of food, clothing, shelter, fuel, utilities, and other personal requirements. So that is a very long list of things that basic needs assistance is supposed to help with. Shelter, food, anything else that somebody needs to clothe themselves. The amounts for that income assistance are spelled out in the income assistance regulations, primarily at sections 48 and 49. And those amounts are wholly inadequate. The standard household rate for a single individual who rents or owns their home and is not deemed to be disabled is a mere $686 per month. That sum, again, is supposed to pay for food, clothing, shelters, fuel, utilities. That sum does not provide enough money for people to live on. If somebody is deemed to be disabled, they can qualify for the standard household rate enhanced, but only if they are a single assistant or assistance recipient who rents or owns their home. In that case, currently, their entitlement can go up to $950 a month, or with the disability supplement, presumably that amount would increase to $1,250 per month. For quick context, the latest rental market survey by the Canadian Housing and Mortgage Corporation reports that the average price of a two-bedroom rental unit in the Halifax area is $1,628 per month, an 11% increase from the previous year. The amounts for the basic needs assistance for anyone who is not receiving the enhanced standard household rate are not increasing likewise. There is no indexation, no increase in the amount of basic needs assistance that they're receiving, despite rent going up by 11%. And if we look backwards in time, we can see that those amounts have increased year over year. For a two-bedroom unit, a vacant two-bedroom unit in 2014, according to the CMHC, was renting for $985 per month, compared to this year's $1,658. That is a 68% increase over that 10-year period, and much higher than the 27% inflation rate that the Bank of Canada set for the country as a whole during that period. Rents are fast outpacing, the growth of rents are fast outpacing the cost of living in general, and especially for income assistance recipients, they are falling behind each year. Each year that there's no activity to index income assistance rates, the situation grows worse and worse. Human rights lawyer Vince Calderhead has conducted annual in-depth analyses of the inadequacy of income assistance recipients' budgets. A single adult without disabilities in the Halifax area makes only 34.8% of the poverty line, and a single adult with disabilities, with the new disability supplement factored in, makes 59%. Both of these figures are outrageously inadequate, but especially for someone who doesn't qualify for the enhanced standard household rate, that sum of money in their basic needs assistance does not provide for a dignified life. The latest report by the Maytree Foundation from April 2023 on income assistance across the country reports in their analyses of the 2021-2022 income assistance caseload in Nova Scotia that there were 27,977 open ESIA cases in Nova Scotia with a total of 42,778 beneficiaries. Of these cases, 73% were unattached single-person households, and almost 60% of beneficiaries were women. The province may respond to these analyses, and has in the past, that the income assistance rates do not represent the total universe of benefits that, that income assistance recipients are entitled to receive. That's why Vince Calderhead's data has factored in the affordable living tax credit and the poverty reduction tax credit. One item, however, that has not been factored into previous analyses has been the availability of housing supplements, and in particular, the Canada-Nova Scotia Targeted Housing Benefit. I recently did a Freedom of Information request on this, and of the 6,080 recipients of the Canada-Nova Scotia Targeted Housing Benefit as of February 27th of this year, only 3,415 of those recipients were receiving income assistance. So a little more than half are receiving income assistance, or so are receiving an additional benefit. However, that means that there are many, many thousands of income assistance recipients who are not receiving the Canada-Nova Scotia Targeted Housing Benefit. And if those numbers are consistent with the numbers of income assistance recipients in public housing, then there are many more people who do not have additional assistance. So my representation is to call upon the province to amend its budget to index income assistance rates to the rate of inflation. This would not make the income assistance rates adequate by any means. However, every year that this is not done, the basic needs of income assistance recipients are slipping farther and farther behind. Thank you. That concludes my submissions.
Thank you very much for your presentation. I'm going to go now to members of the committee who would like to ask a few questions. I'll recognize MLA Clark, please.
Thank you, Mr. Chair. Mr. Culligan, thank you for being here. Really appreciate your presentation. One of the things about this issue that's particularly frustrating is that the government, as I'm sure you know, has indexed income tax brackets in general and chosen not to do that for income assistance, even though the cost to government would be significantly less to do that because we're talking about a smaller number, a smaller benefit, but the benefit to the person would be much greater, right? Someone making $70,000 a year, if they save $200, that's not really changing their life in much of a way. But if we're talking about $686 a month and all of a sudden you get an extra $20 or $30, that's material, right? And that's the part that bothers me about this the most. That's more of a comment, I know. But my question around indexing, I know we were the only province in the country up until now that wasn't indexing income tax brackets. Do you know what other provinces and territories do on income assistance in particular? Are we kind of out of step with the rest of the country on that front as well, if you know?
I'll recognize the speaker, please.
Thank you. I don't know. I haven't completed that jurisdiction scan. However, when we do look at other rates of income assistance across the country, what we are seeing is that on average, our rates are falling farther and farther behind other jurisdictions.
Thank you. And MLA Burrell, please.
Thank you. Well, thanks for this explanation. And I just wanted to ask you, with this freeze on the rates for non-disabled recipients, do you, and that not being the case for disabled recipients, do you see here kind of raising its head older ideas that we used to hear about? At one time the words were used, deserving and non-deserving, poor. We even used to hear words like worthy and unworthy. Do you see that older kind of division and thinking at work in the way that this freeze is being implemented?
Recognized speaker, please.
Certainly, that's a fantastic question. In fact, I would say that that's baked into the structure of the Income Assistance Act, is that it draws a distinction between the deserving poor and the non-deserving poor. You can look at Regulation 49 of the Income Assistance Act, and it defines who's currently entitled to a higher additional amount. Those people are those people with a disability, or people with a chronic mental, cognitive, or physical condition that limits participation in employment services, people fleeing an abusive situation, people 55 years or older, or a young person receiving assistance. What is the commonality amongst these criteria? I think there's a determination that these people would not otherwise be expected to work and effectively are deserving in the sense that they're not being required to work. So as this distinction, this distinction grows between people who are eligible for additional enhanced rates and those who are not, the Act is becoming it's returning more and more to its roots as a piece of legislation that is saying some people have a legitimate right to receive income assistance and some people don't. And that's reflected in what are fast becoming punitive forms of benefits that bear no relationship to any evidence-based study or decision-making on what it actually costs to live in this world.
Thank you very much. Do we have any other questions? If not, thank you so much for your time and your presentation today. Have a great rest of the afternoon.
Thank you.
Moving on now to our next speaker. Vince Calderhead, please. Do we have copies? Okay, perfect. Welcome this morning. As previous speakers, you have 10 minutes to present, with up to 5 minutes for follow-up questions from members. If you could identify yourself and how you would like to be identified by the members. When you have 1 minute left to your 10 minutes, I'll just say 1 minute so that you know you're almost done. And then we'll go into questions after that. I'll start your 10 minutes after your introduction.
Thank you. My name is Vince Calderhead. I'm a human rights lawyer. I work at Pink Larkin in Halifax. And I've worked and taught at the law school for over 25 years in the area of what's called poverty law. All right?
Yep.
So what I've prepared for the committee members is a version of what I call my budget briefing note. That is to say, when the budget was announced, we carefully went through the budget and as it impacts people in receipt of income assistance. That's my sole focus on this. And so what you'll see, and because of the time, I won't take you through every page, but what you'll see is an analysis of sample family scenarios, single people, boarding, living on their own, single people with disabilities, and then single parents, and then a two-parent family with 2 children. And what you'll see on those pages is a precise identification of the sources of income support and the total amounts received. So if sometimes people say with social assistance, it's very difficult to know what they're getting. Everyone gets different amounts. These amounts are set by regulation. There's no question about them. Special needs are a different issue. So with respect to basic needs allowances, it's all there. And what I've done in addition is compare it to last year's budget and what the rates were set there. And then I've also added all federal and provincial refundable tax credits. Every single source of income that a person on assistance would get is found there. So the totals that you see are the totals that people on income assistance have been, will receive under the current budget. The only increase at all is for single people with disabilities. The province announced that it will provide an additional $300 a month for someone in that situation, and you'll see it referred to on page 4. And what I do on the very bottom of each of those family scenarios is compare them to Canada's official poverty line. In 2019, the federal government, with the concurrence of the provinces, established for the first time in Canadian history an official poverty line. So you'll see in the bottom right-hand corner of each of those scenarios what percentage of the poverty line is reached by people on income assistance. So for the case of a single adult with disabilities, just by way of example, on the bottom right-hand corner of page 4, it's 59%. 59% of the poverty line is reached even with the announced $300 a month increase. I just add, Statistics Canada says that anyone whose income fails to meet 75% of the poverty line, they're in deep poverty. So if you, I won't take you through the others, but you'll see those scenarios. Then if you look on page 7 of the submission, I set out in a table a summary of all those family scenarios. They're set out across the top of that table. Single adult, boarding, owning, single person with a disability, a single parent, and a couple with 2 children. And you'll see their total annual incomes there. So a single adult boarding, $8,800 per year. Couple with 2 children, $35,000 per year. That's including all credits from all sources. And then look on the bottom row, it's the total income as a percentage of the poverty line. This is Canada's official poverty line. Single adult boarding, 31%. Single person considered employable, almost 35% of the poverty line. In brackets, you'll see the level from the year before. A couple with 2 children, 62% of the poverty line. The only reason those numbers aren't lower, not because there's been an increase in assistance, is because of what the federal government has been providing by way of the, I think it's called the Canada Carbon Rebate. And that new income source is the only thing that has allowed people on assistance to tread water. So then let me move from there. We think of social assistance rates, and again, I'm looking on page 7 is where that chart is. Social assistance rates, so you see the adequacy table. In every single case, it's below the deep poverty line that Statistics Canada has drawn. So they're nowhere near adequate. The next thing I would talk about is that with inflation, we all know about inflation the last few years, and I referred to it there on page 8 of my submission. The last time income assistance rates were raised, in the second paragraph on page 8, I have a few numbers. The last time they were raised was in May of 21. Since then, inflation has gone up in Nova Scotia by over 13%. Food alone, 21%. And housing costs have gone up over 19%. What have the rates gone up, except for people with disabilities? 0%. Not a penny. Not this year, not last year, not the year before. That's on the one hand. On the other hand, the budget responsibly and carefully and properly indexes income tax brackets. Why do they do that? Why is the budget doing that? In order to ensure that people's standard of living isn't eroded by significant inflation. So is the same kind of attention paid to low-income people on assistance? Not at all. Nothing has been done. These aren't simply political questions, policy questions, and so on. These are also human rights questions. And I set out on the bottom half of page 8 of my submission some background on the human rights to an adequate standard of living. Nova Scotia and Canada have signed on to the Covenant on Economic, Social, and Cultural Rights, 1976. It's a core part of international human rights law. Under that covenant, all governments, federal and provincial, have an obligation to increase, to improve the standard of living. By failing to index rates, by failing to move toward the adequacy level of the poverty line, Canada is now in violation, and Nova Scotia is in violation of its international human rights obligations. I'll turn lastly to some recommendations. On the last page of my submission, I have 2 recommendations about how Bill 419 should be amended. And you'll see them set out there. These are proposed recommendations to Section 21 of the Employment Support and Income Assistance Act. The first one calls upon, seeks that the Act be amended to, within 3 years, bring all social assistance rates up to the official poverty line. That's within 3 years. The second amendment I would propose that this committee consider is that once that has been achieved, to then peg those rates on a semi-annual basis to the consumer price index, so that once adequacy has been achieved, it's maintained through an indexation process. That's presumed as being responsible and adequate, and that's no less the case for the most vulnerable in the province. Unless there are further questions, those were the core of my submission.
Thank you very much for your presentation. I'll now ask members of the committee if there are any questions, and I will recognize MLA Lachance, please, to start us off.
Hi, thanks so much for being here. How would you describe the effect of your proposed amendments for folks in Nova Scotia? So the effect of achieving a sense of adequacy and then having that index over time.
Recognize the speaker, please.
Thank you. I think there are 2 main effects. One, it would allow the most vulnerable in our society to achieve a measure of dignity and self-respect, to be able to buy lunch for themselves, to be able to buy milk. I'll never forget the story of the mother who came home after being out, looked in the fridge, turned to her children after looking in the fridge and said, "Who was drinking milk?" That's about respect, that's about nutrition, that's about human rights compliance. The second benefit of that is that when people are treated with dignity, when their right to an adequate standard of living is protected, the public and the government saves costs in the justice system, in the healthcare system. And so it's a win-win situation. And I think that's why the committee would do well to seriously consider the kind of amendment that I've proposed.
Thank you. Do we have any questions? If no others, I'll go to MLA Lachance, please, for a second question.
And I just wanted to remind the chair that I do use they, them pronouns. So there's just been a couple of times when you've referred to me as she and her. So my question is regarding other jurisdictions. So are there other provinces in Canada that have done a better job of getting anywhere close to adequacy and also managing through this time of inflation.
Recognize the speaker, please.
Thank you. Yeah, every year, the Maitrey Foundation publishes a survey of social assistance rates across Canada and then compares those rates to the adequacy standard, allowing you to say, well, who's doing a better job? The worst in Canada rates in terms of adequacy are found in New Brunswick. The second worst are in Nova Scotia. It doesn't have to be this way. Provinces like Quebec are very close to the official poverty line with their rates. It doesn't have to be this way. We can change it. And in fact, it didn't used to be this way. Rates have declined since the late 1980s in terms of adequacy. So that's a result of political decisions. And it's fully open for this province to make a policy decision to amend the Act in the way that I've recommended.
Thank you. Any other speakers? If not, thank you so very much for your presentation today and your time coming in. Moving on to our next speaker, please. This would be Alex Stratford, please. Good morning. So as with the previous speakers, you'll have up to 10 minutes to present to the committee, and then there'll be 5 minutes follow-up from committee members. And if you could start by just identifying your name as well as any organizations that you're here representing, how you'd like to be identified by the committee, and then we'll move right into questions.
Thanks. My name is Alex Stratford. I'm the Executive Director Registrar with the Nova Scotia College of Social Workers. Pronouns he, him. Happy to be here today.
Whenever you're ready.
Great. I'm so pleased to be here today to speak to the long overdue introduction of the Office for Children and Youth. The recent legislation efforts to establish the office mark a crucial step forward to our province. While the details regarding its functions and scope are still forthcoming, this initiative is a beacon of hope for children, youth, their families, and the people who serve them. The Nova Scotia College of Social Workers would like to acknowledge the work of the new minister, Brandon Maguire, and his leadership for moving this office forward. It speaks to the minister's commitment and dedication to vulnerable children and youth. I also want to thank the staff of the Department of Community Services who orchestrated a fantastic consultation sessions and shepherded a steering committee through to making recommendations towards the minister. I also acknowledge member Steve Craig, member Lisa LaChance, who I've spoken to many times about the crucial need for this office, and I'm happy to see it in legislation today. We find ourselves at a crucial point in time. It's imperative that we protect our children and young people from the potential pitfalls and obstacles prevented by government inadequacy and inefficient systems. To achieve this, creating an independent entity committed to championing the well-being and rights of children and youth is vital. The urgency for creating this office cannot be overstated. Nova Scotia is one of the few remaining provinces in Canada to do so and to have such an office. Our children and youth are falling further behind, and our continued neglect of their needs will have dire consequences in our society. The provincial budget's framing of our current political context of issues of affordability and cost of living missed the mark. The real challenges lie in addressing rising inequality and the growing divide between the haves and the have-nots. The Office for Children and Youth is desperately needed to tackle these issues head-on to enable children and youth and families to have access to the social determinants of health so that they can reach their full potential. On the dire need, the NSCSW investigations, consultation, and research has found that systemic racism in our child welfare system disproportionately affects Black and Indigenous families, necessitating immediate action to end racism in the prevention of child welfare policy. For example, the amendments to the Children and Family Services Act in 2017 have deepened inequalities for marginalized communities, highlighting the need for legislative reform. Our current child welfare policies and practices are perceived as being overly punitive, prioritizing standardization, protection, and surveillance over support and empowerment. Additionally, funding shortages for family and child well-being, especially for historically disadvantaged communities, leave many without the necessary supports and services. Poverty and housing insecurity, as Vince Calderhead just outlined, are root causes of many issues within the child welfare system. We learned during the pandemic that the application of CERB, when we lifted many families out of poverty, we also reduced the need for intervention services. Addressing these foundational problems through structural change is imperative for improving interventions, reunification processes, safety, and overall well-being. Recruiting and retaining social workers, particularly in child welfare, remains a significant challenge. We must educate the public on the important and critical work social workers perform each and every day and the impact they have on the lives of vulnerable Nova Scotians. Government must tangibly value and support social workers, the profession, and in so doing, conduct a comprehensive review and strategic workforce planning, considering gender dynamics as one of the key areas necessary to overcome these challenges. Furthermore, bureaucratic obstacles, restrictive policies, and staff burnout have hindered collaboration among social services, health, and justice institutions, preventing vulnerable populations from receiving adequate support. Enhancing communication and cooperation among these entities is essential. To achieve these goals, the Office for Children and Youth must play a pivotal role in shaping a brighter, more equitable future for our children and youth. This commitment extends beyond a moral obligation, its profound investment in our collective future. The office will need a clear mandate and funding of around $10 million annually to focus on conducting independent investigations into complaints or concerns on behalf of children and youth, ensuring every voice is heard and acted upon. Specialized units will need to be established to address the unique needs of Indigenous and Black children and youth, confronting structural inequities and historical legacies head-on to pave a way for empowerment and equality. The office must have the authority to provide individual advocacy and public education, empowering children and youth with knowledge of their rights and available services, policy and system advocacy that will seek to influence legislation and government policies for the better must be employed as well, while research on issues affecting children and youth in Nova Scotia will aim to hold government accountable for implementing evidence-informed policies that will lead to greater outcomes for children and youth. Access to justice must also be prioritized, with advocacy efforts aimed at making justice accessible, efficient, and tailored to the needs of children and youth. Additionally, the office must conduct critical injury and death reviews to recommend improvements to programs, services, or broader public policy tragedies. Through these initiatives, the Office for Children and Youth will not only advocate for the rights and welfare of young citizens, but also illuminate path forwards towards a future filled with hope, opportunity, and justice for all. Together, our actions will pave the way for a tomorrow that champions the well-being of every child and youth. The establishment of the Office for Children and Youth represents a pivotal moment for our province. It offers a path forward to addressing the long-standing challenges and ensuring a brighter future for our children and youth, which are currently dire. Together, this act can make a significant impact to uphold the rights and well-being of every child, but we must get the functions of the office and the funding of the office right to ensure this. Thanks for your time today.
Thank you so very much for your presentation. I'll now go to members of committee who may have questions, and I'll start by recognizing MLA Lachance, please.
Hi, thanks for being here today. You talked about some of the things that the office needs or would need, and I'm wondering if you have suggestions for what needs to be contained in the legislation.
Recognize speaker, please.
Yeah, we recognize that the legislation gave a lot of powers to regulations to determine what the scope of the office ought to be. Ultimately, when we look at the history of advocacy offices in Canada, oftentimes we don't get it right the first time and we need to go back and fix it later. Ultimately, we do need to see the full range of powers that other advocate offices have in Canada, which include individual advocacy, systemic advocacy, policy advocacy, access to justice, and have restorative processes as well to ensure that we can collaborate towards a better future for children and youth. Currently, these aren't outlined in the Act itself. These are to be done in regulations. I take the minister at his word that he's serious about putting these scopes into place, but I'm here today to articulate the vast need for that full scope to be there.
Thank you very much. Recognize MLA Regan, please.
Mr. Stratford, actually, that was my question. So is there anything else that you would like to see in this particular piece of legislation to ensure that children get the protection and the consideration, as we heard earlier, during policy discussions the way that we do in theory when we take a gender lens to things.
Recognized speaker, please.
Yeah, so what we've been advocating for is Prince Edward Island has the most up-to-date and the last Child and Youth Advocate Office legislation that was put forward in Canada. It's the most modern at this point in time and has the provisions that would be required to deliver the full mandate of this office. Again, that's what we've always looked to and always said, you not look much farther than there. That has the tools that we need. What's really going to be key here moving forward, of course, is staffing and funding, which we don't have a clear picture of yet at this point in time. Ultimately, you will need a commissioner with competencies to understand gender, race dynamics within the provision of services to children and youth, as well as a full budget to implement all of that. You know, we look at Manitoba's advocate office as a model for that, currently operating at around $7 million. Now, we recommend $10 million because former Minister Carla McFarland had indicated that she wanted the office to go above and beyond what most advocate offices are doing. So that's in funding. So that's what we'd look to next. Certainly, again, we know that this was introduced as a way to move it forward. I did media in the fall saying there was urgency to this, so I can't really criticize the fact that this is moving with urgency at this point in time, but we do need to absolutely see the full scope of an advocate office in legislation sooner rather than later.
Thank you. MLA Clark.
Thank you, Mr. Chair. Mr. Stratford, you're a great witness because you keep answering questions before they're asked, but I was going to ask you about the budget number that you raised in your speech, but you just told me the answer, so that makes a lot of sense, and just wanted to thank you for your advocacy. Thank you.
Thank you, MLA. Do we have any other questions? If not, then thank you very much for your time coming forward today.
Thank you. Thanks.
Our next speaker, Alfred Burgerson. We are running a few minutes early, so we will come back. Dr. Gus Grant. Good morning. Welcome. We have, as previous speakers, the two of you do have 10 minutes to present, and then members will be provided with up to 5 minutes for questions if there are any. If you could both please identify yourselves for the record, as well as any organizations that you're here representing, and then once you've done your introductions, we'll start your time at 10 minutes whenever you're ready.
I'm Dr. Gus Grant. I'm the Registrar and CEO of the College of Physicians and Surgeons of Nova Scotia, pronouns he, him.
I'm David Fraser. I'm a privacy lawyer with McGinnis Cooper, working with the College of Physicians and Surgeons, he, him.
Whenever you're ready.
Thank you. My submissions will relate solely to Section 110 of the Financial Measures Act. This is which offers new language to the Personal Health Information Act. If passed, Section 110 is going to fundamentally change the nature of the patient-doctor relationship and the professional duties of physicians. This new law will require all physicians to enable access to their medical records to the minister. For physicians, this creates a new professional legal duty, and for patients, it means the entirety of their medical records will be accessible to government. In addition to the reasons stated in the section itself, the Premier has advised the College that this language is required to empower patients with their data through such mechanisms as the Your Health NS app. As well, the Premier has advised that this language is needed to empower the health system with aggregate data to enable efficiencies and to allow the system to learn from itself. And I need to be clear, the College strongly supports the importance of both those principles. The College also, however, supports the rights of patients to privacy and the duty of physicians to maintain confidentiality, which is a cornerstone of medicine. The obligation set out in Section 110 runs counter to these rights and duties, or at the very least is in tension with those rights and duties. The work of the college is defined by the Medical Act. The Medical Act sets out the objects of the college, which is to regulate medicine in the public interest. And to meet that mandate, I see it as the responsibility of the college to speak on behalf of the public, which I would expect is largely unaware of this seemingly innocuous amendment and its potential consequences. The Financial Measures Act, by its name and in substance, would seem to have little to do with the private matters members of the public have disclosed to their physician. The college submits it's in the public interest, and it's in the interest of the Law Amendments Committee to consider these questions. First, why the urgency? Urgent steps need to be taken in our healthcare system, and the college is pleased that the legislature and government is embracing urgency. But the key question is whether urgently changing the Personal Health Information Act will meet the present needs. Just a few weeks ago, government launched the Your Health NS app, an innovation that the college supports and lauds. There are pilot projects ongoing, again, pilot projects which the college supports. But pilot projects are done to gather data for the purposes of learning, to prove concepts, to flag unintended consequences. And the unavoidable irony here is that Section 110 aspires to help our system learn through evidence and data, but does so before considering the best evidence and data that will become available. There's been no time and no analysis to evaluate the results of the pilots that are ongoing. At most, we can say that a certain number of physicians and a certain number of patients have adopted the app. The pilot project gives us an opportunity to improve and inform our legislation with learning, and it's an opportunity that we're turning our back on. Another question, what could we learn? What are potentially some of the unintended consequences? We could learn that different patients have placed different values on their privacy. I would not be surprised to learn that the pilot will demonstrate that younger patients are thrilled with the app, untroubled that their health information sits in the government's hands. I would also not be surprised to learn that older folks feel differently. The importance of privacy may vary according to age and other factors. I was a long-standing family doc in this town. I can say with confidence that many of our most vulnerable patients are among those most mistrusting of large institutions in government. This generalization might extend to members of many disadvantaged communities. I'd invite you to draw the analogy to our vaccination experience, where our most vulnerable and most disadvantaged were most disinclined to be vaccinated. I hope that there has been consultations with groups such as the Mental Health Association, or perhaps voices representing our trans or LGBTQ patients, let alone our Indigenous or African Nova Scotian communities. I was disappointed not to see those voices represented on the roster of your agenda today. Let's face it, very few patients are following the lively debate on the merits of Section 110 of the Financial Measures Act. When this becomes law, how will the groups I just described respond to the surprise of learning that their medical records are now accessible to government? How will they respond to hearing their physicians and other healthcare providers are required to give their personal health information to government? Will they protest that their private lives have been disclosed to government without their consent? Will this break trust with physicians? Will those most in need of care turn away from care? Here's another question. How is a physician to respond to a patient who asks, "Hey doc, can you tell me what will be done with my personal health information? Who will have access to it now that you're required to disclose it to the minister?" This question goes to the very heart of the patient-doctor relationship. That relationship is built on trust. As matters presently stand, a physician can do no more than say, "Government's committed to working on developing answers to these questions." That answer will put that trusting relationship I described at risk. For planning and management of the healthcare system, we've heard that government needs aggregate data. I agree. Section 110 empowers the minister to compel personal health information, which by definition is individualized data, not aggregate data. And the minister will have access to this personal health information as the minister deems necessary, a term which I would suggest is uncommonly broad. So how might we mitigate these risks? Could we achieve the laudable goals of Section 110 with less intrusion on patient privacy? Section 110 requires custodians such as physicians to disclose all personal health information and here's the language, for the purposes of planning and management of the healthcare system, resource allocation, and for maintaining personal health records. The specifics of the disclosure are undefined, subject to only other provisions within FIA. Again, personal health information by definition is individualized, not aggregate data. I loop back to how will we know how it will be used or what are the potential menaces without studying the experience of the pilot project? Could we modify the language of the legislation to perhaps limit the extent of disclosure, the depth of the scrape, or perhaps more importantly, to limit the accessibility to that information? I want to make an important distinction, which is this. The college fully supports an informed system. I don't think we should be concerned about disclosure of information so as to enable patients to have a better access to their experience with the healthcare system. But access is different than disclosure. And I've yet to hear argument as to why access to identifiable health information is required to empower the system or to advance the goals that government appropriately is seeking to address. If the pilot or other evidence, perhaps through consultation, confirms that there are certain vulnerable or equity-deserving groups who may be negatively impacted by the implementation of the Your Health NS app, or might be negatively inclined towards such disclosure, would those groups find comfort if the depth of the scrape, the amount of disclosure, or the parameters of access were more clearly defined?
1 minute.
Thank you. We can look at other jurisdictions. I would point you to the Alberta experience where it's disidentified non-individual access that's granted. I would also pose the question, what role, if any, has the Privacy Commissioner played in this? A piece of legislation that most centrally strikes at the mandate of the Privacy Commissioner. In the interest of time, I'll leave my submissions there. I would say that my submissions were endorsed by the College of the Council, which is a group made up of elected physicians, and by members of the public. I would also say that whereas I'm not speaking on their behalf, my submissions have been supported by the executive of the Regulated Health Professions Network, which represents all 23 regulated health professions in the college. Mr. Fraser and I are available for questions, and I appreciate your indulgence as to time.
Thank you very much, and that was pretty much right on time, so thank you. We do have a number of questions. I will recognize MLA Regan first, please.
So I just want to make sure that I understand how the government will get this information. Is it through the My Health app, or is it through One Patient, One Record?
Recognize speaker, please.
I'm not sure I can answer that question because I don't know.
Yeah.
But the mechanism that I understand to be put into effect will be that all custodians of health records, so physicians and other health professionals, will grant full access, are required mandatorily to disclose all of the contents of their records to government. That will then be, in turn, can be fed to such platforms as Your Health at Nova Scotia, so that the patient has a direct and active record. The distinction I'm wishing to bring to the attention of this committee is disclosure of that information is something separate and distinct from access by the minister to personal health information, which again is by definition identifiable to you, the patient.
Thank you very much. MLA LaChance, please.
Thank you for being here today. I'm wondering, Doctors Nova Scotia proposed an amendment, and I'm wondering if you think that would be a sufficient amendment, or if in fact there are other amendments that you would recommend. And I don't know if you've had a chance to look at that.
Recognized speaker, please.
I was here when Doctors Nova Scotia made their submissions. That's the first I've heard of that. I think it's progress towards an appropriate goal. I would say this, though. Being unfamiliar with the details of what future agreements may say, or whatever data governance document is put in place, I can't really comment on that. What I would hope would be considered for legislation is this distinction between the disclosure of personal health information for the purposes of empowering patients and the access to personal health information by the minister, because by definition, again, personal health information is patient identifiable information. And I'm not sure how patient identifiable information can be used for the purpose of aggregate system learning.
Thank you very much. I will go to MLA Clark.
Thank you, Mr. Chair. Just to your point you just made, Dr. Grant, because I think it's an important one, and I want to understand exactly kind of your position on this. So what, in your mind, would you be comfortable with in terms of when does data no longer become patient identifiable, I guess? And I assume, correct me if I'm wrong, I assume your position is if we got to that point where the data that the government's collecting is not patient identifiable, but could be used to say we can draw conclusions, you know, you'd be supportive of that. So what would make, what is not in the bill right now that if it were in the bill, you would say I'm comfortable with that because it's not patient identifiable anymore?
Dr. Grant, please.
My answer would be that if the language of the bill made clear that personal health information is disclosed for the purposes of such things as your health, so enabling patients, but moreover that the language of the bill made clear that access to information by the minister would be limited to accessing non-identifiable information. Again, right now the language is the minister may access personal health information, which by definition is identifiable to the individual, as the minister deems necessary. I think that I would encourage, because again, the college strongly supports the stated goals of government here and embraces that government is seeing the urgency in our healthcare system right now. Are we at the point where the minister can access personal health information of an individual patient? If so, I think that light should be shone on that question. Again, I'm not sure many patients are aware that Section 110 of the Financial Measures Act strikes at the heart of the patient-doctor relationship as I'm submitting it does.
Thank you very much. MLA Regan, 20 seconds.
So my concern is that we may trust this certain government right now, but in the future, that could allow governments to see who's had an abortion, that kind of thing. And all we have to do is look south of the border to see how that's applied to impinge on the rights of women.
We don't really have time to answer because the clock's going to go right now. So thank you very much for your presentation. I do appreciate that and your time.
Thank you.
Thank you very much. Moving back on our agenda, I'm wondering if we have Alfred Burgenson there. Okay. Very nice to see you again.
Good to see you.
How are you this morning? Thank you
thanks.
for coming in. So you'll have up to 10 minutes to make a presentation to the committee, and then the committee will have up to 5 minutes for any questions that they may have. I'd ask that you identify yourself for the record, as well as any organizations you might be here to represent, and then we'll start off with your 10 minutes presentation as soon as you're ready.
Sounds good, thank you. So my name is Alfred Bergeson, the founder and CEO at Tribe Network. Really here representing myself because I'm passionate about the act in respect to the Office of Children and Youth, and so I'm here to chat about that.
Whenever you're ready.
All right, so I want to start by perhaps providing some context to why I'm here and why I'm speaking about this topic. I'm 27 years old, and this is something that I'm incredibly passionate about. I spent some time years back in the city working on various youth initiatives. I was a member of the Prime Minister's Youth Council for a few years, and so got firsthand experience related to advocating for young people across the country. This is an issue that I've advocated with the previous government and this current government, and I think it's an issue we can all agree is a nonpartisan issue. It's really important, especially in today's world where young people are feeling disengaged, are feeling like they really don't trust institutions like the government. I do think this is a critical opportunity. So the feedback that I want to provide is, I have a few. I think the first is we should pursue and look at having multiple commissioners versus just one. Similar to the format of the African Nova Scotian Land Titles Initiative, having multiple commissioners allows the work of the office to be, I would say, more efficient, more effective, and to involve more than just one person. For an issue like this, I think it's important to have youth involved from different geographical locations of the province, different ages, different races involved with the commission. I think the commission shouldn't just be to carry out investigations on children's services. While that's really important and critical, it's quite reactive. I think the commission should also pursue opportunities for young people that are proactive in relation to engagement and empowerment activities. And I'll give you an example. When I was on the Youth Council, the government came to us and said, hey, we're building this new youth digital gateway. And they were really excited about this youth digital gateway. And I asked, well, who's building this thing? And they said, well, we've hired a consulting company, and this is the budget we spent on this. And to me, that was a missed opportunity to get young people engaged in the building of the actual thing. And so what we ended up doing was setting up a youth innovation challenge, where 15 young students that were designers, computer science students, artists, had the chance to build the youth digital gateway that they would use over the course of the day. And what it did was it allowed the government to capture methods, tools, resources that young people wanted to use, and a variety of them. And it also gave these young people a chance to build their portfolio, right? So when you're looking for a job, you can say that I helped design something that the government can consider and implement. So I think it's important that this office not just be a reactive one, but a proactive one in looking at opportunities across government for young people to be engaged in designing solutions. And I guess the last thing I wanted to bring forward is I think the commissioner should be young. I think looking at Canada's definition of youth, they should be between the ages of 15 to 34. As I mentioned, it'd be great to have more than just one. I think another thing that would be helpful is to ensure that these roles are perhaps not necessarily bound to being employees of government, but can also be professional folks who are contracted. That would allow young people who are, whether it's in the healthcare industry or have other jobs that they're tied to participate as a commissioner for this office. And I think, getting appointed for multiple years is important so that we're not creating unrealistic timelines for folks. So perhaps appointing folks with a minimum of 3 years, giving them a runway to work on various different initiatives and strategies related to the office is important. And I think that's all I have to say.
Thank you so very much for your comments today. We do have a question. I'll recognize MLA LaChance, please.
Hi, thanks for coming in today. I'm wondering, based on your feedback, and so, multiple commissioners, diverse youth engaged, that sort of thing, are there changes that you would propose to the legislation that's currently in the Financial Measures Act?
I recognize speaker, please.
So I suppose some of the feedback that I'm providing could be used to amend the various kind of stipulations in the Act related to the Office of Children and Youth.
Thank you. Any other questions? No other questions. Thank you. Before you go, I do want to thank you for coming forward today. And for those that don't know Tribe, I would certainly encourage them to come up and visit with you guys up on Barrington Street. You're doing some wonderful work up there for our African, Nova Scotia, Mi'kmaq communities, and we appreciate your time today. So thank you very much.
Thank you.
Moving on now to our next speakers. That now means we're moving into our 9th speaker. It does mean that we adjust our times accordingly now. So each speaker from this point forward will be given up to 5 minutes to present to the committee, followed by 5 minutes of question from committee members. And to start things off today, we are going to a virtual presentation. This would be Jack Baker. And good morning. Welcome to Law Amendments Committee. Thank you for taking the time to log in today. I'm going to allow you quickly to identify yourself and any organizations that you may be here representing. And then once you've done that, we'll start your timer off with 5 minutes for your presentation and 5 minutes for questions from committee members. So if you'd like to go ahead and introduce yourself.
Yeah, great. So my name is Jack Baker, pronouns he, him. I'm joining you online today because I'm currently in my 2nd year at U of T in Canadian Studies and Political Science, although I'm originally from Halifax. And I'm here today to advocate for children and youth in Nova Scotia.
Wonderful. I'll start your timer now.
Great, thank you. Thank you for allowing me to speak today. Today I want to address an act representing the Office for Children and Youth of the Financial Measures Act. Despite this act, there's still no exact timeline for the creation of a Child and Youth Office, leaving our youth without a dedicated advocate for the time being. This summer, I helped facilitate the One Chance to Be a Child Youth Forum. Working as a diverse group of youth from all over the province, the goal of the forum was to provide Nova Scotian youth with a platform to share their experiences, concerns, and solutions regarding youth health and well-being. We wanted to work with youth to create positive change in communities across the province. Throughout the project, our group of youth identified 5 main areas of concern, which included affordability, mental health services, access to resources, youth substance use, and climate change. For me, this project only exemplified the need for action to be taken in this province. Nova Scotia lags behind other provinces in establishing a standalone office for child and youth rights. An office is crucial for assessing children's voices, working with existing organizations, and holding the government accountable for its inaction. New Brunswick and Newfoundland and Labrador are both great examples of where child and youth rights offices have effectively addressed issues that face youth. 2 examples from these provinces include addressing youth mental health care and discrimination against 2 LGBTQ+ youth. I would like to see the same level of proactive measures in a Nova Scotia Youth Advocates Office that was taken by these offices in addressing these systemic issues. This action included comprehensive reports that provided recommendations that were obtainable and followed through on. To better highlight the immediacy of the implementation of this office, I would like to highlight the inequity faced by youth in specific communities such as African Nova Scotian youth, Indigenous youth, 2 LGBTQ+ youth, New Canadian youth, and youth with disabilities. These communities of youth face increased inequality in our province, and the 2021 One Chance to Be a Child report from the Department of Pediatrics and Healthy Populations Institute at Dalhousie University highlights this with the following statistics. 20% of 2 LGBTQ+ youth felt disrespected because of their gender identity, and 40% felt disrespected because of their sexual orientation. In addition, 36% reported feeling unsafe or threatened at school in the previous month. Indigenous children aged 0 to 4 represented 52.2% of children in foster care in 2016, while making up only 7.7% of the child population within the same age group. 40% of African Nova Scotian children live in poverty compared to the provincial child poverty rate of 22.2% and the national child poverty rate of 17%. Additionally, 1 in every 2 immigrant children in Nova Scotia live in poverty compared to approximately 1 in every 5 non-immigrant children. Additionally, another thing that cannot be ignored is the impact of climate change on youth. The inclusion of an environmental/climate change plan in the office mandate is essential for the future well-being of youth in Nova Scotia. My final point that I would like to make is the inclusion of a youth advisory board as part of this new act. A youth advisory board ensures that perspectives, experiences, and needs of young people are directly represented in the decision-making process. As well, inclusivity is promoted and diverse voices from various backgrounds can be heard. Involving young people in the decision-making process empowers them and sends the message that their opinions and contributions are valued. A youth advisory board provides first-hand insights into the priorities, challenges, and aspirations of the youth population. Collaboration between the office and the youth advisory board fosters a sense of partnership between government entities and the young people they serve. Involving youth in decision-making builds trust between governments and the younger generation. It enhances the credibility of the office and demonstrates a commitment to transparency and openness. It's time for Nova Scotia to take bold steps towards a brighter future for children and youth. Let's advocate for a change and make sure every child in Nova Scotia truly gets one chance to be a child. Thank you, and that ends my submission to the committee.
Thank you very much for that. And I will ask, do we have any questions of our presenter? Any questions? If not, we have no questions. I want to thank you so very much for taking the time and zooming in on with us today, and I hope you have a wonderful rest of the day. Thank you.
Thank you.
Bye-bye. Moving on now to our next speaker, Kevin Russell. Mr. Russell? No? Okay, I didn't think I saw him. So we are running a bit earlier, but I do see our next speaker, which is Howard Epstein, please. Good morning, and how are you? I hope things are well this morning.
Yes, just fine. Thank
you.
Nice
to see you. I'm sure you always love to be back in the House.
I'm thrilled to be back in the House and to be here in a committee that I used to be a member of.
Well, you do have 5 minutes to present with 5 minutes for questions from members. Just for the record, I will have you, you don't need to introduce yourself to probably any of us, but for the record, I will have you introduce yourself, please. And if you're here representing any organizations, if you could identify that. And then once you're finished, I'll start your 5 minutes.
Thank you very much. My name is Howard Epstein. You may use he, him, Mr. in my last name, or just my first name. I'm happy with any of those things. This is, I should say, a purely personal presentation. I'm not here on behalf of any organization, including any political party. Thank you. Picking up on that, the nature of this as a personal presentation, it's really a focus on matters of law, and myself as a municipal lawyer, that is a lawyer who is specialized in land use planning matters. Some of you may know that I was a member of Halifax City Council when it still existed, and then the first council of HRM when it was created. I also taught land use planning law at Dalhousie Law School as an adjunct member of the faculty for some 15 years. I published a textbook on land use planning law, 600 riveting pages on the law of zoning, as well as numerous articles. I'm a great believer in the virtues of local government and its importance. But I have to say, I try to pay close attention to matters of land use law here and across the country, but really I only became aware of the particular set of measures I want to speak to today that are included in the Financial Measures Act when a friend phoned me a couple of days ago and drew my attention to them. So much as Dr. Gus Grant pointed out when he made his submission with respect to Section 110, this is kind of hidden. It's not obvious that the Financial Measures Act actually includes as fully half of its sections matters that have to do with municipal and land use planning law. This was a big surprise to me, and I'm sure it's not really well known. I noticed that on the speakers list, there's no one really from the affected community. There's no one from the official organizations representing planners or architects or the municipal government associations and or lawyers who practice in this area or academics who do it or the general public. And because I value, and I hope all of you do, the process of public consultations, I say it would have been a much better process if, as I say, almost half of those sections that are in the Financial Measures Act that deal with municipal and land use planning matters had been developed in a different way. The appropriate way would have been for the government to issue a white paper in which it explained what it saw as the issues or the problems, set out its preliminary thinking, and invited the public to have things to say. That leads generally to much better kinds of bills and legislation. And if it were merely a passing issue, I wouldn't have been concerned with it, but there are at least 4 problematic provisions in those sections that deal with. One is the provision about selling or leasing land at below market value. The other is the exempting of healthcare facilities from planning rules at the municipal level. The other is that planning notices could all go online rather than be published in a newspaper. And the last is the set of provisions having to do with development agreements. Now, I think that the Municipal Government Act and the HRM Charter both probably need general examination, and there are many things that if I were asked, I would put forward that are not in this bill, but I've just identified 4 that are in this bill that are problematic. And the one I particularly want to draw your attention to is the provisions in clauses 29 and 75, that is amendments to both the Halifax Charter and the Municipal Government Act, that allow the sell or lease of land, municipal land, which I should point out is held in trust for the benefit of the residents of communities, to be sold off at below market value, not just as is now the limitation in the statutes to nonprofits, but in fact to profit-making companies. This is just plain the wrong choice. It's open to abuse, flagrantly open to abuse, and it offers what's known as a bonus in the language of municipal law to some particular business in preference to other businesses. And
1 minute.
Thank you. It goes contrary to a longstanding general provincial position that municipalities ought not to be encouraged to compete with one another. So, for example, this opens up the door when it comes to the economic realm. This opens up the door to one municipality saying, oh, well, we've got land for sale and here's the low price we're going to offer, and another municipality comes along and says, oh, well, we can do better than that. That's not what the province normally encourages. Furthermore, this seems particularly to be aimed at a current issue that is in front of HRM Council, which is the Wanderers Grounds, a portion of the Halifax Common, where a for-profit company wants to have access to this public land at a price that is clearly not a market price. So altogether, I would say that what I'm encouraging this committee to think about is to take the sections of the Act, 25 through 54, and then 72 through 105, and excise them and invite the appropriate department to issue a white paper. Thank you very much.
You're very welcome. I gave you 30 seconds there just to get the last in. I do have a couple questions. I'll recognize MLA Regan, please.
So lovely to see you back in the building again. It's been a while. So basically, the last point you made was that you could see municipalities sort of trying to outbid each other at having a fire sale for property that would go to for-profit entities to bring them into town. Is that it? And do you think that this piece was inserted about the Wanderers Ground? Is that where its genesis?
A recognized speaker, please.
Thank you. It's certainly what I imagine, but with no formal consultation or openness about the process, there's no telling where this came from. As I see it, there's nothing that's urgent in any of the sections of the Financial Measures Act that deal with municipal and planning matters that are so pressing that they have to go forward, that would prevent them going through a white paper kind of consultation.
Any other questions? If not, thank you so very much. And it was a pleasure to see you here again. Thank you.
Thank you very much.
I'm sure we'll see you again in the future. Thank you so very, very much. Moving on, I'm going to ask if, I know we were running early, so Kevin Russell. Is Kevin Russell here? We'll carry on. Peter Duke. Mr. Duke. Jackie Barkley. Well, we seem to be running a few minutes early, and I'll ask just one other. Carrie Smith? Yes? Okay. Welcome, and I have a Jeffrey Smith too. I don't know if he's coming up. Okay, he's just here to be the supporter in the back.
Good day.
And I know you've been here for a while. I've seen you sitting, so
Yes.
5 minutes to present, 5 minutes for follow-up questions. If you would like to introduce yourself, and then we'll start your time.
I would like to. My name is Carrie Smith. I am here for mostly personal. It took a lot of courage to get here today, and I speak on behalf of someone, a lived experience of sexual assault.
I'm going to ask if, does Mr. Smith want to come up too? Or?
Come on.
Okay.
Thank you. I appreciate it. Lived experience of sexual assault, privacy breach, and not enough resource in our province.
I'll start your time now.
To all MLAs of Nova Scotia and Law Amendment Committee members, I thank you for letting me come here today. I would like to be clear. The public needs to have trust to receive safe health care from providers. They also need privacy. Giving custodians access to detailed patient records without patient consent should not be a best practice. I am not against advancements in new technology for the purposes of healthcare improvements and accessibility, nor am I against providing options for patients to obtain safe pathways to access their healthcare information. But there is a concern regarding lack of resources available for individual victims of privacy breach. Nova Scotia lacks an enforcement officer for the Personal Health Information Act. So if a custodian should be found to have violated patient privacy, complainants may be left to fend for themselves to address the issue. Meaning that there are very little resources available, and it takes a lot of research. Not everyone may have the time to educate themselves. Communities have worked tirelessly to encourage victims of various assaults to trust their healthcare circle. To receive treatment, patients need to know that they are safe sharing details that sometimes require reports to law enforcement. Details and accounts of serious injuries, diagnoses, and sometimes sexual assaults and abuse. The loss of trust that could make it very difficult for doctors and nurses to treat future patients. Knowing that details of those reports could one day be accessed outside of that circle of care could deter would-be future patients from seeking health care or needed treatments of all kind, both physical or therapeutic. Therefore, it is my view that patients should be informed and with their basic human right decide individually exactly what private health information is accessed or shared and the intended use, such as research. As the Minister of Health mentioned, aggregated data. Does the public know the use of aggregated data? Is consent required? I don't know. Patient information is of great monetary value and requires careful considerations and protections against misuse. I implore the members of this committee to consider the possible impacts to mental health of existing and future patients that believe their information is held in the strictest of confidence with the highest levels of security. I would worry that this change to existing legislation could be risky. Taking into consideration the Nova Scotia government has already ordered a review of the Freedom of Information privacy legislation, and working groups are reported to deliver recommendations by spring of 2025. Why add new custodians now? I worry that our Nova Scotia government has not kept pace with technology and may not be able to provide appropriate privacy protections for yet another group of custodians. Patients have a right to informed consent when attempts are made to give custodians not in their circle of care access to their private health information. And I'm sorry, I should have added for uses other than providing health care.
1 minute.
It is also my understanding, but for a few exceptions, Canada's data law requires that health information custodians obtain consent before they collect, use, or disclose personal health information. But the most important piece is that the public continue to expect that conversations, including sensitive healthcare information, details of mental health diagnosis, and trauma be kept confidential between doctors, nurses, and therapists, unless required by law to save a life. Sorry. Or with informed consent when deciding to share outside of that circle of care. I thank you all for allowing me to be a voice today, not just for myself, but so many others. And I thank you for your time.
Well, thank you very much.
I welcome your questions.
Thank you very much for your presentation. We do have one question. I'll recognize MLA Regan.
Thank you, Ms. Smith, for coming in today all the way from Digby. You had traveled many kilometers and I think are bringing a personal perspective that I wish all Nova Scotians realized what was going on right now, because I don't think they do. I am concerned about the chilling effect this will have between patients and their doctors. Could you speak to that at all?
I'll recognize the speaker, please.
Is there a time limit?
We have 5 minutes, yeah, but you can take
Okay.
You can take as much time to answer her questions within the 5 minutes. And I have on the list one other person who'd like to ask a question.
Okay.
Yeah.
I'm being careful as I'm experiencing the effects of intrusion into that specific information without my consent or knowledge. And that is why I reference the resources. As a sexual assault survivor, I had actually attempted to end my life before telling anyone. And, I'm here by some miracle. I would have left. My family wouldn't have known why. And I realized that I need to do something. I may not be the only one. I found out that I'm not alone. It's unfortunately, it happens on an astronomical level. It's not something that is spoken about in polite company. We're working on that. We've got a long, long way to go. I had my own stigma, and I was afraid to come forward. I was afraid to come here today. I received many messages. Please speak for me. You can do it. Stay strong, those comments, and so for a survivor, you worry about your future in medical care. Will physicians want to treat you? Will they trust you? I don't go in alone. When I go, I take a support person so that my healthcare provider doesn't feel uncomfortable with me, so that there isn't any, and sorry, I know I'm looking around, but so that there isn't any, I don't want to make them feel at risk either. I want to be as comfortable as I can be in a safe environment. And I do worry that the details that we share, that I've shared personally, is not something that just anyone should have access to. And it should be used very carefully for specific purposes because of the damage that can be done. My fear is, when I saw this in the news, I cried all night. I may have slept for an hour. I was very impacted by the thoughts that someone may have immediate access to information that took me about 6 months to talk about. And I'm a fairly strong person. I've worked with the public all my life. In finance, public facing, I didn't see it. I didn't see me reacting this way, and I would encourage others in my lifetime. So I really, really believe that we need to do a little bit of a backtrack on this one and maybe get some insight from persons like myself. We need to make healthcare safe as we can, and I do believe that this could put many, many, many lives at risk.
Thank you. I'm going to go to MLA LaChance, please.
Thank you so much for being here, and I doubt I have very long. So I'm just going to quickly ask. So you were proposing that this wait until the full freedom of information and privacy legislation review is undertaken. You're suggesting that that this wait until the full review is undertaken.
So I'll recognize the speaker with 1 minute left.
Okay. Yes, I believe that there are many brilliant minds and a lot of healthcare professionals that could help, therapists, psychologists, psychiatrists, people that are client-facing, trauma-informed, that they be able to review this before moving forward so that we do it in the best, safest way, and we make sure that we protect it from, cyber attacks. This is very sensitive information, and I worry that in the wrong hands, it could be misused. It's just that type, it's on that level of security that it should be recognized as such and very valuable to the owners of the information. So I'm not sure that I can add much more to that, but I would sleep better tonight knowing that would be the outcome. So I do hope that is.
And that concludes your time. I do want to thank you very much, all the way from Digby.
All the way from Digby.
Well, thank you, Liz. Thank you so much for taking the time to drive up. We really appreciate that. And, I think a lot of times we wonder do we make a difference? And I think you might have. So thank you very much for coming forward today. I really appreciate that, as I'm sure all the members do. Have a great afternoon. Members, we're going to take a very quick 5-minute break, resuming here, we'll say 6 minutes, so we'll resume at 12:15, please.
Order. I just arrived in the chair, so I'm going to ask the committee members again to introduce themselves. My name is Dave Ritzie, and I'm the vice chair of the committee, and I'm here to chair the rest of the day. Also like to recognize our legislative counsel, Gordon Hebb to the right and Karen Kinley to the left. But I'd like for our members to introduce themselves, if they can kindly do so, starting with the government side with MLA McDonald.
Good afternoon. Johnny McDonald, MLA for Hants East.
Hello, Trevor Boudreau, MLA for Richmond.
Good afternoon. Steve Craig, MLA for Sackville, Cobequid.
Hello, everyone. Chris Palmer, MLA for Kings West.
Lisa Lachance, MLA, Halifax, Citadel, Sable Island.
Susan LeBlanc, MLA for Dartmouth North.
Braden Clark, MLA for Bedford South.
Kelly Regan, MLA for Bedford Basin.
Thank you, members. So I'm going to call our next presenter to come to the mic, and I see Mr. Russell's here today, so please join us at the front. Thank you, Mr. Russell. We'll have 5 minutes for a presentation, 5 minutes for questions from the members, excuse me. And if you could refer yourself to an organization that you may represent and how you'd like to be addressed by the members during questions.
So just to be clear, it's 5 minutes, not 10.
5 minutes.
Okay.
Yeah, correct.
Whoa.
So your time will start when you start speaking.
Okay. Kevin Russell, Executive Director, the Investment Property Owners Association of Nova Scotia.
Okay.
Thank you, Chair, members of the Law Amendments Committee. As many of you would know from my previous appearances over the years at the Law Amendments Committee, the Investment Property Owners Association of Nova Scotia represents private sector rental housing providers in Nova Scotia. IPONS has been the voice of responsible investment property owners in Nova Scotia since 1978. Our approximately 160 members manage more than 50,000 rental property units across the province. Our members are urban, suburban, and rural. Our members pay taxes, employ Nova Scotians with good salaries, and give back to their communities in many ways. Our members are also the #1 source of providing affordable housing for Nova Scotians. And many of our members are suffering because of government policies like rent control and lack of action by successive governments, PC, Liberal, and NDP. The parties you represent have created the housing crisis, and policies like rent control are making the housing crisis worse, resulting in more homelessness. When government makes things worse for rental housing providers, they make things worse for tenants. There is nothing in Bill 419 that addresses this reality. Rent control continues. There is no investment in a compliance and enforcement unit for residential tenancies. There is no support for rental housing providers who are losing money because of government policies. And with 97% of rental housing income coming from rents, the government, with current rent control program, has crippled the ability of many rental housing providers to stay in operation, let alone make a profit. Anybody who claims that the government policy is based on some mythical right to profit doesn't know what they're talking about. It also false to claim that the majority of rental housing providers are large corporate entities. Here are the facts. In 2021, IPONS commissioned an economic impact assessment report by Gardner Pinfold. The report noted most rental property owners are small scale and often individuals making lower profit in Nova Scotia than the national average. Expenses are rising, so there is little room, if any room, for business to succeed on lower revenues. Since 2021, the cost to own and operate rental housing have shot up thanks to inflation, interest rates, insurance costs, energy prices, carbon taxes, both the Ottawa version and the one we pay in Halifax Regional Municipality. property taxes, and mortgage rates. As money-losing rental housing providers sell their property, new owners are either moving in or renovating their properties. Both result in displacing existing tenants. The majority of rental properties in Nova Scotia were built before the mid-1990s. They require renovations to be safe and modern. Renovations require money. That's another economic reality. And more data to consider. According to CMHC, before the reintroduction of rent control in 2020, Nova Scotia rents increased at a lower rate than in rent control jurisdictions in British Columbia, Ontario, Manitoba, and Prince Edward Island. Since rent control has come back to Nova Scotia, rents are skyrocketing as new units being built are charged out at a higher rents to mitigate the effects of rent control on existing units. As the association warned politicians at the Legislature Law Amendments Committee in 2021, rent control in Nova Scotia will result in more homelessness and higher rents. Sadly, our warnings came to pass. Nova Scotia's rent control has led to more homelessness, existing housing supply taken off the market, and the highest rent increases in Canada. I hope all members read recent public comments from CMHC, which were recently published by Saltwire. I quote the following for the record. CMHC senior analyst Calvin Nodero says the rental cap has created a spin-off consequence with which Cape Breton in particular is struggling. The problem is small property owners and managers deciding to stop renting properties because of rising costs. With the recent financial difficulties we've been facing in the country, increased inflation, higher cost of living, increased operational costs, and stuff like that, it's affecting small property managers, he said.
1 minute.
In Cape Breton's case, Nodero said it's unique for its large secondary rental market, loosely defined as rentals in buildings with fewer than 3 units, such as converted townhouses. That contrasts with a typical apartment building, which may have several units. But unlike in many other Canadian cities, Nodero said CBRM's rental market is made up mostly of these secondary rental markets. His estimate was that out of more than 12,000 rental units in CBRM, around 80% of them are secondary rental rentals, most of which are owned by small landlords and property owners. That's why the recent rising costs come in. Nodero said those costs are starting to reflect the supply of these units because small owners are being hit the hardest. This increasing trend is pushing small property owners into possibly selling properties due to rising costs. This affects the supply and brings down the vacancy rate. According to CMHC, in the fall of 2020, when rent control was introduced, the vacancy rate in rental housing in CBRM was more than 8%. Since rent control was introduced, the vacancy rate was just about 0%.
Order.
What is the answer?
Order. The time has elapsed for presentation. Are there any questions from committee members? MLA Clark.
Thank you, Mr. Chair. Mr. Russell, thank you for being here today. I just wanted to ask you about something I know we've talked about, and it's been talked about a lot without much action, unfortunately, and that's around residential tenancies enforcement. I know that's something that generally IPONS is supportive of. I know lots of tenant organizations are as well. I know the NDP have legislation. We've had legislation. The government has said they're looking at this. Have you, in the last little while, and hopefully you get access to information more often than we in the opposition do, but have you had any discussions with government in the last little while about that piece in particular, and do you think that's going to happen at some point?
Mr. Russell?
Thank you for the question. We haven't had conversations, and so I can't predict the future, but we know that the compliance and enforcement unit is needed, and we need to know what form it will take. Yeah.
Are there any other questions from committee members? Seeing none, I'd like to thank you so much, Mr. Russell, for your presentation today.
Thank you. Take care.
Okay, we now will move on to our next presenter, Peter Duke. Good afternoon, Mr. Duke.
Good afternoon.
We'll same presentation, 5 minutes. Questions from committee members will be 5 minutes as well. And I'd like for you to start off by introducing yourself and how you'd like to be addressed during questions, and if there's any organization that you represent. Mr. Duke.
Certainly. Good afternoon, and thank you to the chair and to committee members for the opportunity to speak this afternoon. My name is Peter Duke, and I'm a lawyer at Dalhousie Legal Aid. I'm speaking today on behalf of the Child Welfare Advocacy Coalition. We are a group of individuals dedicated to ensuring the safety and well-being of children and youth, their families, and the professionals who work hard to meet their needs in the child protection system. We were pleased to see that Nova Scotians with disabilities have been supported by this budget with significant spending increases for more staffing. The government has a duty to protect the rights of its most vulnerable. 56 positions in disability support is a great start. Children involved in the child protection system are also among the most vulnerable of all Nova Scotians. We are disappointed to see that no new funding has been directed to address a serious concern in the child welfare system, a system that is crucial to supporting some of our most vulnerable families and children. Members of our coalition have hands-on experience working with and supporting children, parents, foster placements, and frontline Department of Community Services community service workers involved in the child protection system. I want to talk specifically about frontline child protection workers. The job of a frontline child protection worker is incredibly difficult. These workers investigate reports of child protection concerns. They identify and arrange services for adults and children with the goal of reuniting children and parents when that is possible. They spend time getting to know families and working with them to identify supports and services that will help them to be better parents. They try to keep families together and protect children who cannot otherwise protect themselves. Members of our coalition are seeing more and more examples of workers who are quite simply overwhelmed. They are unable to regularly meet with families. They do not have time to be doing the difficult work of supporting family reunification. One of the major reasons for this is the heavy caseloads due to being understaffed. Our coalition has identified recruitment and retention of staff, in particular, frontline child protection workers, as a significant problem with the child protection system. It is common for families that I work with, in my job as a lawyer working with child protection respondents, it's common for them to have several different workers while they navigate a legal process that is by statute limited to 18 months. With family makeup hanging in the balance, the stakes could not be higher. Every time a family loses their worker, the progress made in building relationships, developing rapport, and having a working knowledge of the family is lost and must be rebuilt. Building trusting relationships takes time. In the child protection context, this trust can be even more difficult given the sometimes adversarial nature of the process. I've recently had a file where my client had both children placed back in her care. This is the happy ending that we look for in these files. During this critical period of transition, there was no contact from her worker. There was no support around bringing these children back into the home. There was no support for troubleshooting issues that may come up. The situation is not fair to the families, nor the workers who are trying their very best in a challenging environment. When workers don't have the time and resources to do their jobs, it is the children who suffer. It is families who miss access visits, who face delays in accessing needed services to help get them back on track. Increased pressure and demands on workers means lower quality work. Frontline workers are not staying in this role for very long. The human cost is that families miss out, children miss out, things get delayed. The vast majority, thank you. The vast majority of my clients have multiple workers throughout their file, and as I said, those are generally a year to a year and a half. Beyond the human cost, there's also tremendous financial cost in replacing workers. The cost associated with advertising, hiring, training staff are significant. We ask this government to commit additional resources to the recruitment and retention of frontline child protection workers and provide them with the supports they need to do this difficult and important work. Right now, workers also have a huge administrative burden. There's not, as I understand, administrative staff to support the affidavit writing, the report writing, and the record keeping. That's a significant part of their job. Thank you for the opportunity to speak to you this afternoon, and I look forward to addressing any questions that the committee members may have.
Thank you, Mr. Duke. I have a couple questions. MLA LeBlanc and then MLA Lachance.
Thanks for your presentation. Do you have a sense of how understaffed the frontline child protection workers are? Like, do you have a recommendation of how many FTEs are needed, for instance?
Mr. Duke.
Thank you. From what I've heard and from other members of our coalition is that some offices are down to 50% of their ideal staffing. So I don't know the hard numbers, but as a proportion, it's my understanding that some offices are down to half of full staff complement. And supervisors who have been working for years are having to pick up files and do that frontline work, which again takes away from their ability to support other staff. So it does have these kind of cascading effects.
Thank you, Mr. Duke. MLA Lachance.
I'm wondering if you can comment on how, so, you know, what was Schedule B is now Schedule A, to create an office for children and youth. How do you think that would impact an issue like this?
Mr. Duke?
Are you asking about the Child and Youth Advocate Office? Okay. Well, I think I have high hopes that it will be, I think that it's long overdue in Nova Scotia, and I have high hopes for it having a positive impact. I think that, as I noted in my presentation, I think children, and in particular that are involved in the child welfare system, are among the most vulnerable people that we have in our province. So I think that the Office of the Child and Youth Advocate could have a great impact on ensuring that the staffing levels and that the work done in child protection is the best quality and keeping children at the forefront.
MLA LeBlanc.
Thanks. I have another question. In your opinion, in this situation where there is so much understaffing, and even if there was a full staff complement, what is your opinion about the 18-month timeline for child protection cases to be resolved, quote unquote? Do you think in either case that should be looked at, that amount of time, or is that sort of a sensible amount of time, but is more difficult given the understaffing?
Mr. Duke?
It has certainly been made more difficult by the understaffing. And in terms of if I think that 18 months is appropriate, I think that it is important to give a timely resolution to families. What I would like to see is for their judges to have a greater discretion to extend those timelines in situations that warrant it, in particular where there's been delays in accessing services and making progress that are not the fault of the families but are because of these issues of staffing. And right now there is no allowance for that. I've had families that have been waiting months to get a family support worker, and the time keeps ticking away. They aren't making progress because they don't have the tools that they need, but it's not their fault, and that seems an unjust situation.
Seeing no other hands, I'd like to thank you, Mr. Duke, for your time today. Appreciate you coming in to present to the group.
Thank you.
Thank you. Before we call the next presenter, I noticed we had two new committee members arrive, so I'd like for them to introduce themselves. MLA Nickel.
MLA Laura Lee Nickel for Cole Harbour, Dartmouth.
MLA Rafael Di Costanzo, I'm the MLA for Clayton Park West.
Thank you so much and welcome. So we'll call our next presenter, Jackie Barkley, to come to the mic. Good afternoon, Ms. Barkley.
Good afternoon.
My name's Dave Ritzie. I'm the chair or vice chair of this committee, and I'll be chairing the rest of the afternoon. And our committee members are all here. I'm sure you've heard all the names that are on both sides. So anyways, we're going to start off. Your presentation will be 5 minutes, and then we'll push it back to our committee members, and they'll have 5 minutes to ask you questions about your presentation.
Okay, thank you.
And we'll start your time as soon as you introduce yourself.
Well, my name is Jackie Barkley. I'm a clinical therapist and a social worker, and I've worked at the IWK, I've worked on mental health issues, I've worked at the Nova Scotia Hospital, and for the last 20 years, I have done interventions specifically with the parents involved in the child protection system.
Okay, please proceed.
So thank you so much for giving me the opportunity to speak today. I'm going to be saying some similar things to what Mr. Duke just said, but I want to approach them in a slightly different way, if possible. What I would like to try to do here is to bring a voice to the people I work with, who are the parents in the child protection system. And I say that because if your children have been removed by the state, even when the reasons might be appropriate, so I'm not saying we don't need child protection action, but when your children have been removed by the state, there is no more horrible thing that can happen to you, if you think about it. I would also like to speak briefly by presenting a profile. This is not a profile of any of the individual persons I work with, and this is not to say that all of the persons I work with have all of these dimensions to their experience. But the profile in general of the child protection persons that I work with is that they have suffered traumatic childhoods themselves of sexual, physical, and emotional abuse. They have often been abandoned themselves as children in a variety of ways. They have often dealt with their own trauma through a very frequent involvement in severe substance abuse. They are often suffering from a number of significant mental health disorders. They have sometimes been involved in street prostitution, and they have almost invariably been victims of significant domestic violence. So those are the parents of the children. So we're talking about intergenerational trauma in many, not all, but in many cases. They are not going to come to the Red Room. They're scared. They desperately want to do whatever is needed to try to have their children come home, if at all possible. So they're not going to come and complain to you. They're not even going to complain to their child protection workers, and they sometimes will not even complain to their lawyers when they feel that their efforts and rights aren't being met. So the reason I'm emphasizing this is because the Department of Community Services is one of the most complex departments. It is huge. It's one of the big four. And what I want to talk about is that while I recognize that the department is making efforts toward resolution of difficulties in the foster care system in particular, I want to talk about the entry point into the child protection system, because in my experience, it's the entry point into the child protection system that is actually at the greatest loss of the appropriate resources at this time. And the best metaphor that I could make is if you're trying to go from Halifax to Dartmouth and the bridge is broken, or the bridge is closed, or there are several accidents on the bridge, your ability to reach what you're going to do on the other side is virtually impossible. So I'm speaking to that very particular bridge when complaints go into intake and complaints are assigned from intake to frontline child protection workers who are not the people working in adoption and foster care. And it is that group, it is that location at the moment which is lacking in the resources to do their job. So at the very moment that you have a short period of time, like Mr. Duke has talked about, to try to straighten out your life with a profile I've just talked about, that is where the workers are most stressed. That's where they are leaving most quickly. That's where they are carrying caseloads that are astronomical. Now, the official caseload that will be heard is what I've heard, somewhere around 20 cases. But in fact, if your colleagues have just left, if they've fallen off the bridge, your caseload has doubled in 24 hours. It takes a really long time.
1 minute.
1 minute?
Yep.
Thank you so much. It takes a really long time to correct that. So it's not just a question of please more money, please more resources. It's please more resources to try to do 3 crucial things to being able to get your children back. Number 1, retaining access to your children, being able to see them in the allotted time. Number 2, improving the caseloads so that your social worker can see you more than once every 2 months. And number 3, the adoption by the Department of Community Services in that space of family case conferencing, of which Mi'kmaq Family and Children's Services has some of the best model to provide with us. Do I have 2 seconds? Sorry? I think with my 20 seconds, I would say I implore you to address this problem, because every single child who can't return home is going to a system, not without good intention, but a system that is not the safety and protection psychologically of a healed family unit that they can belong to.
Order. Time for presentation has elapsed. Do we have any questions from our committee members? MLA LeBlanc? Oh, okay. MLA Lachance.
No, you go. Okay. So my question is, if you could just talk a bit about, you know, what happens, like what is the experience like for children in this scenario where people can't get the right kind of support in the right timeline?
Ms. Barclay?
Yes, thank you. Because I've been a social worker for a really, really long time, more than 40 years, I've seen the beginning and the end of the process. So when I worked at the IWK and when I worked at the Nova Scotia Hospital, what I saw was that the long-term implications of not being able to return to your family of origin, not that every family of origin is safe, that's not what I'm arguing, but the long-term process of being able to have the circumstances that could allow you to return your family of origin has consequences that people pay, that those children pay for in their lives until they're old.
MLA LeBlanc.
Sorry, Mr. Chairman, can I add one more little point to answer that question?
Yes, absolutely.
Thank you.
Go ahead, Ms. Barclay.
Thank you. The other thing that I observed over many, many years is that once children in care, sometimes in foster long-term, and even in adoption, by the time they reach their 20s, there is a desperate desire to find their family of origin, however troubled that family of origin was. So while we would like to think that it's a clean process by which the first family's too troubled, too violent to allow children to stay, they then pass on. We then do all kinds of work to try to improve things in foster and adoption, and by the time they turn 20, we have adoption breakdown frequently, not always. And so these consequences are really long-term. Thank you, Mr. Chair.
Thank you. MLA LeBlanc.
Thank you very much for your presentation. And it's kind of amazing to hear from someone who has been working in this area for so long and has seen obviously so much change, or or maybe ebbs and flows of resources. But I guess my question for you is similar to the one I asked Mr. Duke, which is, well, I have 2 actually. So one is the sort of technical question of, what needs to be done? So like, what are we talking about? Do we need to have a certain amount of social workers hired? What do we need to do to retain those social workers so they're not going off, they're starting in child protection and then a year later, they're going to something that is more supported. And then the B part is, what's the impact on a parent or a family that's trying to do their stuff when their social worker keeps changing because of burnout or, whatever, because of understaffing?
Ms. Barclay.
Thank you. So I've already forgotten the first one. Sorry.
MLA LeBlanc.
Yeah, what are the what's the ask? Like if we're talking about the Financial Measures Act,
right?
What is what would be better to see in the budget or in the act to support these folks?
I think a magnifying glass. Sorry.
No, go ahead, Ms.
I'm trying to respect the time.
Yeah.
A magnifying glass on that bridge, on that part at the beginning of the system, which in my partial view is the most crisis-ridden at present. So if the financial services, if the resources are looked to on what I'm calling that bridge, that intake system and child protection, intense year or year and a half, depending on the age of the child, to begin counseling. I've often been called into a case, sometimes 5 months, 6 months, after the clock has started ticking, and it does not matter how great we might think our therapy is or how great our therapy might be, you cannot transform those embedded complex issues in a deadline that is so small. So that's one thing. The second, from a financial perspective, is that I think that because I've worked in the public system for so long, I've watched the ups and downs in the healthcare system as well as the child protection system. And I remember the days when people would say, we're going to cut all that extra stuff. And the extra stuff turned out to be the clerical staff that knew how to fill out the forms, that knew how to get everybody to the right place, that knew how to make the phone calls, that knew how to answer the call of the worker or of the client, to know where the worker was in the building, to know the difference between an emergency and a non-emergency. So I think there's a profound assumption that if we just put all the work into the profession.
The time for answers has, that's great. So, thank you, Ms. Barclay, for your presentation and joining us this afternoon, and thank you so much. Have a great afternoon. Okay, my apologies, I did miss my colleague, MLA White, if he could kindly introduce himself.
MLA John White, thank you.
Thank you, welcome to the committee. All right, so now we'll bring Brian Crawford to the front. Good afternoon, Mr. Crawford. Good afternoon. So you'll have 5 minutes to present. I will let you know when you have 1 minute left, and 5 minutes for questions from committee members. Just for the record, if you could kindly state your name and how you'd like to be addressed, and questions, and
okay.
And I guess any organization that you may represent.
Well, my name is Brian Crawford. I was employed as a social worker with the Department of Community Services in their Child and Wellbeing Division, which is Child Protective Services. So that would be things like intake of child abuse allegations, long-term program where they follow up with families, foster care, adoptions, and children in permanent care, which is where I spent most of my time. So children in permanent care are youth who've been removed from their parents' care and been placed under a permanent care order, which means that a family court judge has terminated their parental rights, and the Minister of Community Services is then their legal guardian. So I don't imagine anybody here on the committee knew that Brendan McGuire was in charge of so many children, but in fact he is. In any event, I've been retired for 2 years. And I'm sure there's others who have come here to speak about the inadequacy of income assistance rates being frozen in the current budget and the negative cost this will have on Nova Scotian society. But I'm not here to talk about that. I'm here to talk about where I worked, which was Child and Wellbeing of Community Services. And in terms of tying it to the budget, my understanding is that division of community services represents about a 10% of the total Department of Community Services expenditure. So what concerns me about that is that that does not make this sector of their work a priority, and that is most unfortunate because there are a lot of negative consequences of not making it a priority of the Department of Community Services work, because it is a section that works with some of the most vulnerable families and youth, and in fact it is mandated to serve those people. So some of the negative consequences of that sort of budgetary constraint is that it is a very negative and stressful work environment. It's a very complicated work. It has a very steep learning curve, as evidenced by its 1,500-page policy manual. And yet, that workers spend more and more time doing sort of paperworky administrative work due to a lack of appropriate sort of clerical supports. And child protection work is a relationship-based work. And how do you develop relationships with your clients who are in probably some of the most difficult circumstances of their lives, with so much on the table in terms of will they be able to continue to care for their children, when you are tied to your desk doing bureaucratic chores that could well be done by someone who's paid much less than you are. Anyway, so the losers in this scenario are the vulnerable families and children that the department is mandated to serve. Because of this kind of focus and an excessive workload and excessive bureaucratic demands, staff turnover at the department is at an all-time high. Working conditions are so poor that the department cannot recruit or retain staff. There is no one in the department's hiring pool. Some offices are functioning at a 50% staff complement due to staffing shortages. In some cases, offices have asked retirees to return for brief periods to help ease the strain. And in some offices, supervisors have taken on caseloads because of the just lack of people bums in chairs to do the work. And the sad thing about this constant turnover is that, as I said, this is complex and difficult and stressful work. It would benefit by having a experienced and knowledgeable staff, which it doesn't have because of this constant turnover. There are, in some offices, there are workers with 2 or 3 years experience who are the senior workers in their office. So that's who you're looking to for guidance. And yet at the same time, the department seems to have all kinds of specialists in this and specialists in that, which when I worked there, and like I said, I've been retired.
1 minute, Mr. Crawford.
Oh, I better speed it up. When I worked there, which like I said was 2 years ago, I never understood what the specialists did. I never understood how they benefited my work. I never saw their effect of what they did in terms of improving my work life. Also, the department doesn't have the resources it requires to meet the high needs of many of the youth that are in its care. So therefore, because it doesn't have the resources to meet the needs of children in its care, it places children in unlicensed facilities, which are extremely expensive. At one point when I worked there, there were 70 such placements. These placements take 1 child each, and they cost over $40,000 a month. I guess the argument I'm making in terms of budgetary issues is that that money is kind of spent in a not a well thought out way. It's spent as in a knee jerk because of the emergency. They're meant to be temporary, and I've known youth that have lived in these situations for 2, 3, 4, and 5 years. And that again, we're talking about youth that are traumatized. We're talking about youth for whom the Minister of Community Services is their legal guardian.
Order. The time for presentation has elapsed. I will now go to the committee members. I have 2 on my list. MLA Nickel.
Thank you, Mr. Chair, and welcome, Mr. Stewing. And I want to acknowledge you and Ms. Barkley and Mr. Duke for the great work that you do. I know at one time in my life I thought I wanted to be, it's Mr. Crawford, it says Dennis Stuping on the thing down there. That's what, Mr. Crawford. So I just wanted to, my apologies. I knew if I wanted to be a social worker, I would have to take on a lot of other people's pain, so I want to acknowledge the good work that all of you that are doing that each and every day. But, and as an MLA now, I find myself sort of caught in the crossfires between caseworkers with DCS as well, and from, people feeling that you use the word allegations. And so therefore, I trying to get a better understanding of the what kind of training you're specifically saying that is needed and how many staff trained are needed, and also what specific amendments would you like to see in this the FMA and the Financial Measures Act that would do like what everyone has said, that very critical point of intake.
Mr. Crawford.
Well, I would say that I would think the primary problem at the department is recruiting and retaining staff. And like I said, there's a steep learning curve, so it's all well and good for the department to train staff, and I would argue the training is inadequate. But if you train staff and they stay 2 years, then you have a constant turnover. You're constantly having to train staff. You don't build up a culture of knowledge and expertise. You don't build up a culture of mentoring. And people come in and they're immediately overwhelmed, like thrown in the deep end, as it were, and they don't stay. So, in terms of the budget, I think the whole department could certainly benefit by being, by greater funding, but specifically it needs to deal with problems of recruitment, retention, and the lack of appropriate placements for very disturbed and traumatized youth in its care, that it is unable to manage and therefore turns to private. And when you turn to a private, I don't know how the minister places children in placements, how it decides that a child caring facility has to be licensed, but oh no, we don't have enough, so now we're going to set up a whole series of unlicensed, where of course the staff requirements, the same people who work in unlicensed placements couldn't get a job in a licensed placement because they don't have the qualifications, because there's no standard. You have a clean criminal record check and a clean child abuse check, you're good to go. I used to make a point when I visited these placements of asking the staff, oh, what else do you do for a living, or is this your only job? And people would say, well, I work in retail. I talked to one guy, he was an airline pilot. Some people were sheriffs. Some people were jail guards. One woman worked in a knitting store. One woman was the sister of the man that owned the service provider. Anyway, I'm starting to rant now. You should cut me off.
MLA Di Costanzo.
Thank you, Mr. Chair. And if I may, and it really is the most difficult thing at the same time that we're losing that many staff and population is increasing. And we want a double population, and we're increasing with immigration as well, which is something I've always advocated for. But I've also worked as a medical interpreter and went sometimes with patients to the hospital when they needed social work. And the knowledge that needs, and the fact that the social workers who are not used to what happens in other countries and how different it is. I remember one young lady who had a 5-year-old, and she had, I believe, I can't remember the disease, but her bones were soft because of vitamin D, and she was bruised very easily. And right away, she was taken to the social worker and talked about her child being taken away, and I had to explain that to her. They are not, so what is, I mean, you're having hard enough time to find staff. What are you doing for improving the life of immigrants if we're increasing this immigration and doubling population? We should be looking at whatever the numbers of staffing right now and doubling that and tripling that. So, sorry,
Mr.
that's
Crawford.
my question.
Certainly need to promote a more diverse staff. I mean, the office I worked in might have had one worker of African Nova Scotian descent, let alone any other kind of ethnic background.
MLA LaChance with 15 seconds.
I'll just say thank you for coming and speaking to these issues. And if I had had the time, I was going to ask specifically, what measures around retention do you think would work? But maybe we can hear about that offline. So.
Oh, excellent. That's great. Thank you so much. So the time is elapsed in our presentation. Thank you, Mr. Crawford, for your time this afternoon and your presentation. Ask the pages to pass out Mr. Crawford's summary. All right. So we will move on to our next presenter, who will be joining us virtually. Mr. Stubing, did I pronounce that properly?
You did, yes.
Okay, perfect. Well, welcome to the Law Amendments Committee. Just to let you know, you'll have 5 minutes to present, with 5 minutes from questions from our members. Your time will start when I acknowledge you and you finish introducing yourself. I'd also ask that you provide us with how you'd like to be addressed during questions from our committee members, and if there's an organization that you represent. So, Mr. Stubing, please proceed.
Wonderful. Thank you so much, and good afternoon, everyone. I'm Dr. Dennis Stubing. My pronouns are he, him, his. I'm calling from the traditional and unceded territory of the Mi'kmaq and Pinuit-Mi'kma'ki, which is also known as Kentville, Nova Scotia. I'm director and co-owner of Wisdom to Action, a consulting firm with a social enterprise commitment that facilitates positive change and strengthens community. Our work is largely focused on children's rights and youth engagement, gender justice and 2S LGBTQIA+ inclusion, and mental health and substance use. I'm also the vice president and co-founder of the Society of Queer Momentum, which has a mandate to accelerate social and gender justice on behalf of 2S LGBTQIA+ people. Both organizations work nationally and are registered here in Nova Scotia. Thank you for this opportunity to address you today. I understand that the committee has a role to finally put in place a provincial child and youth commissioner. I want to encourage this committee to provide the Nova Scotia Child and Youth Commissioner with a mandate based on the UN Convention on the Rights of the Child. The Convention on the Rights of the Child is the most widely ratified, legally binding UN human rights instrument. Canada affirmed its commitment to children's rights by ratifying the Convention in 1991. A mandate based on the Convention on the Rights of the Child would ensure that Nova Scotia prioritizes the human rights of children within the structures of government that are designed on their behalf and for their well-being. As the committee may be aware, the Convention on the Rights of the Child is guided by the principles of non-discrimination, best interests of the child, and participation, which I further recommend be adopted as the guiding principles for the Nova Scotia Child and Youth Commissioner and its work. I urge you to draw guidance from the rich history and jurisprudence for children's commissioners, which have been the purview of the UN Committee on the Rights of the Child. The UN Committee on the Rights of the Child offers recommendations and support through responses to state parties' reports on realizing children's rights in their jurisdictions, alongside policy statements on how to implement specific articles, all of which can be found on the UN Committee's website. The Committee on the Rights of the Child is uniquely positioned to provide nonpartisan, evidence-based, practical advice that will align the long-awaited Nova Scotia Child and Youth Commissioner with other Child and Youth Commissioners, including those in other provinces and territories in Canada. Finally, and as part of the guiding principles, and to ensure that all children's rights are realized, equity must be central to the work of the forthcoming Nova Scotia Child and Youth Commissioner. In the context of this province, that means prioritizing those who have experienced historic and ongoing forms of harm, namely Indigenous, Black, African, racialized, queer and trans, disabled, and youth in care, and those with intersecting marginalized identities. The committee can review our recommendations on where the Nova Scotia Child and Youth Commissioner can concentrate its energies in the report we prepared with the Nova Scotia College of Social Workers entitled Building an Ecosystem to Realize Children's Rights and Support Family Wellbeing in Nova Scotia. The report was based on stakeholder consultations, including with those who work with and for children and youth across Nova Scotia. It was informed by young people on an advisory council who had past lived experience within the child welfare system. The report is available on both Wisdom to Action and the Nova Scotia College of Social Workers websites, and I'd be happy to submit a copy to the committee following our discussion today. In summary, I recommend the mandate of the long-awaited Nova Scotia Child and Youth Commissioner should be based on the UN Convention on the Rights of the Child. The guiding principles of the Convention, non-discrimination, best interest of the child, and participation should be adopted to guide the Commissioner's work. with equity centralized for Indigenous, Black, African racialized, queer and trans, disabled, and youth in care, because it will help entrench children's rights within the structures of government. It will align the Nova Scotia Child and Youth Commissioner with other provinces and territories. It will connect them with best or informative practices through the UN Committee on the Rights of the Child, and it will help to address the well-being of all children, including those who have experienced historic and ongoing forms of harm. Thank you once again for this opportunity to speak with you today. I'd be happy to answer any questions you have.
Thank you, Dr. Stubing. I will pass it to MLA Nickel for a question.
Thank you, Dr. Stubing, and as always in this role, you learn something every day, and then I learned today about the Nova Scotia Provincial Child Youth Commissioner being needed, and the UN you mentioned, was that, did you say 2001? So I'm trying to sort of, that's quite a while ago, and so I'm trying to determine how many, what has been done, how many provinces have the commissioner, and how long have you been waiting to see it here in Nova Scotia?
Dr. Stubing?
Yeah, thank you very much for that question. So Canada ratified the convention in 1991. So the Convention on the Rights of the Child has been around for over 30 years. As you may be aware, Nova Scotia used to have an advocate office here in Nova Scotia, but that hasn't existed for years. Other provinces, so I believe most other provinces and territories have a youth commissioner or a child and youth commissioner. So Nova Scotia needs to catch up on that front. So yeah, it's a long-awaited role that's been talked about to be brought back, but there have been advocacy efforts for a number of years. As I mentioned, the Nova Scotia College of Social Workers and Wisdom to Action wrote a paper on this about a year ago after about a year's work on the project. So this is something that's been long awaited by the community across Nova Scotia.
Thank you. MLA Leblanc.
Thank you very much, Dr. Stubing. And thank you for all the work that you and Wisdom to Action do in this area. Your advocacy for a child and youth office or commissioner. I'm wondering what your thoughts are on having a youth advisory committee legislated as part of this office or this, this new entity.
Dr. Stubing?
Yeah, thank you very much for that question. That's very apropos of the guiding principles of developing a commissioner in a role like this, is to find mechanisms of engagement for young people to have voice in the work that the commissioner would be doing. Creating a youth advisory council is a very standard sort of low-hanging fruit opportunity to ensure that that participatory mechanism is there and that the voice of young people is included within the work, which is part of why the guiding principle of participation should be part and parcel to a rights-based approach for an office like this. There are other mechanisms as opposed to one standing council of young people that would have voice. So it could be on an ongoing basis, on an ad hoc or as needed for specific initiatives or projects that the commissioner would undertake. It could be a long-standing entity that would go alongside the commissioner's office. It could be a number of different mechanisms, but participation of young people really does need to be centralized within the commissioner's role. So finding whatever mechanism or mechanisms that make sense in response to young people and their desires, I think is really, really important. So thank you for that, yeah.
See no other questions. I want to thank you, Dr. Stewing, for taking the time this afternoon to present to the Law Amendments Committee.
Thank you very much.
Have a great day. So we do have another, next presenter is Ruth Innes, and she'll be joining us virtually. Good afternoon. Good afternoon, Ruth.
Good afternoon. I'm sorry I was muted.
No, that's okay. That's okay. Just wanted to let you know that you have 5 minutes to present, and then there'll be 5 minutes of questions, potential questions. And if you could, for the record, identify yourself, any organization that you represent, and how you'd like to be addressed during questions. Please proceed.
Thank you very much. My name is Ruth Innes. I'm a fisheries advisor with the Maritime Fishermen's Union. We have 3 locals in Nova Scotia, and you can address me as Ruth.
Okay, thank you, Ruth. Please proceed.
Thank you, Mr. Chairman, for the opportunity to speak here this afternoon and provide testimony to the Bill C-419. I'm presenting on behalf of the multi-species harvesters that make up the Maritime Fishermen's Union. Our members fish lobster, crab, tuna, scallops, herring, along with many other commercially viable species along the shores of Nova Scotia. Currently, the fishing industry in Nova Scotia contributes over $1.68 billion to the economy, of which I'm sure you are aware. The coastal communities all over Nova Scotia depend on this industry to be vibrant and economically healthy. The fishing industry is the main economic driver, and its demise will be catastrophic to our coastal communities and to the province as a whole. There are many players in the fishery when it comes to enforcement. We recognize this challenge, and because of this, our organization has, in the past, convened a table that included every player involved in this complex issue. This was done in order to find solutions to the illegal, unregulated, and unreported fishing that affects the commercial fish harvesters in Nova Scotia. We recognize that this problem has many prongs, and the solution does not rest on one entity or one government department. That said, we welcome the opportunity to work with you to tighten the penalties that the government of Nova Scotia has control over through this bill and the Fisheries and Coastal Communities Resource Act. It is critically important for the future of the fishery in Nova Scotia that your act has the power to prosecute those in contravention of your act. We feel that this act must give the responsible enforceable regulations the teeth to send a clear message that there are dire outcomes to businesses that are in contravention. We believe the following changes should be made to attain this outcome. So I'll just read this. Penalties: a person who contravenes any provision of this act or the regulation or fails to comply with a term or condition of any license or lease issued pursuant to this act is guilty of an offense and liable to a fine not less than $1 million or to imprisonment for a period of not less than 90 days. That's the first change. And we support the Part 3 Fisheries and Coastal Resources Act, which I'm sure you all have in front of you, subsection 116(1) of Chapter 25 of the Acts of 1996, the Fisheries and Coastal Resource Act, as amended by Chapter 2 of the Acts of 1999, is further amended by striking at 100,000 and substituting 1 million. And subsection 116(3) of Chapter 25 is amended by Chapter 2 of the Acts of 1999, is further amended by striking out of not less than 100,000 and no more than 500,000 and substituting not exceeding 2 million. We also believe strongly, and this is incredibly important, that those in contravention of your act should lose their license to operate upon the first offense. Nothing short of this will send a clear message that the province will not tolerate any violation that affects the import of the fishing community's ability to provide the crucial ability to maintain a strong economy for not only fish harvesters, coastal communities, the fishery as a whole, and the province of Nova Scotia. I appreciate this opportunity to present to you today and truly hope that our suggestions will be seriously considered. I haven't had a chance to email this in to you, but I will do this. I will email a copy of this after questions.
Thank you, Ruth, for your presentation. I will now move to committee members for questions, starting with MLA Nickel.
Thank you, and good afternoon, Ruth. Thank you for your presentation. It's interesting whenever I hear about fishing. I grew up across from a fish plant when they decided to end fish harvesting by draggers. So where the fish plant is not there anymore. But that being said, we're hearing a lot of talk about the DFO, lack of enforcement, and my colleague from Clare, Ronnie LeBlanc, I believe you must know his name, has been advocating for a lot of these things that you're mentioning today. But I wanted to ask you, why is enforcement so difficult? You mentioned sections 116 of the acts, changing it from 100,000 to $1 million, but unless they're basically enforced upon and being charged, that seems to be what's missing. So I wanted to ask you, why is enforcement so difficult, and what amendments would you like to see presented in this bill?
Ruth?
Yes, thank you. This is such a difficult issue because, as I mentioned in my presentation, there are many players involved in this. So DFO does their thing. We've been trying to bring everybody together, and there's a lot of sort of a blame game. Well, that's not our responsibility. That's the province, or that's not our responsibility. That's Border Services or CRA, or what have you. And we believe that the enforcement has to be strong enough to send a message that any contravention of this act is not acceptable. Because, as you said, you grew up in a coastal community, you saw what happened to fish plants and so on, and we just can't imagine a Nova Scotia economy without a vibrant fishery. And in order to have a vibrant fishery, everybody, all of the players, must act within the law, and the law is there for a reason, and that's why it's there. Does that answer your question?
Thank you, Ruth. MLA Nicol?
I don't know if you identified and responded to what amendment specifically.
Oh, I'm sorry.
Ruth?
Yes. Thank you. So yes, the amendments that is in Part 3, Fisheries and Coastal Resources Act, subsection 116.1, and the striking out $100,000 and substituting $1 million is the first one, and subsection 116.3, Chapter 25, it's amended by Chapter 2 of the Acts, is further amended by striking out of not less than $100,000 and not more than $500,000, and substituting not exceeding $2 million. Those are very, very important. And I'll reiterate the importance of having the ability to pull licenses upon contravention of the Act.
Okay, no other questions from committee members. Thank you, Ruth, for your time this afternoon. Appreciate your presentation, and have a great afternoon. Thank you, Ruth.
Thank you very much for the opportunity.
So now we'll move to our next presenter, Peter Day. If we can ask Mr. Day to come to the mic. Good afternoon, Mr. Day. We're going to presentations last for 5 minutes, and then 5 minutes for questions from committee members, should they have them. And if you could start for the record, your full name, if there's an organization that you represent, and how you'd like to be addressed by committee members when we do go into questions. So, Mr. Day?
Sure. My name is Peter Day. I'm from Cape Breton, and you can call me Peter, that's fine. I do want to thank you for the opportunity to speak here today, and I do apologize because this was a very last-minute decision to do this, because I had the opportunity to. As I said, I'm from Cape Breton. As the treasurer of the Nova Scotia Teachers Union, I do feel very underprepared because I don't have the financials in front of me, but I would like to address a couple of things. I'm here today to address the concerns that I have surrounding the lack of increase to the education budget line. The Premier and the Minister of Education have taken note of the fact that there is a teacher shortage in Nova Scotia. However, there is a teacher shortage in the Maritimes, across the country, and in fact, all over the world. The question I wish you to think about is this: how do you plan to increase teacher recruitment and teacher retention without increasing the funds to accomplish this? Right now, qualified teachers with the appropriate levels of education needed to teach in Nova Scotia can go anywhere they wish to teach. Why do you think they would pick Nova Scotia? What incentives do we offer to entice these teachers to choose Nova Scotia? Right now, Nova Scotia teachers, specialists, and educational psychologists are overwhelmed with workloads, caseloads, and many classrooms over the classroom cap numbers. On top of this, classroom teachers are dealing with an unprecedented influx of new to Canada students who are dropped into classrooms with little, or more often than not, supports that would help with the challenge of non-English or French-speaking students. Right now, we have classrooms where there are 5 different languages being spoken. So I ask you, by not investing more in Nova Scotia's education program, how do you plan to encourage new teachers to want to teach in Nova Scotia? How do you plan to encourage teachers already here to want to stay? On top of overwhelming workloads, teachers in Nova Scotia are dealing with an unprecedented level of harassment and violence. This is becoming more and more normalized within our schools. Look at the news if you want to see previous incidents of violence. And these are only the ones that you hear about. The vast majority of violent acts that occur in our school either goes unreported or is not spoken about for fear of teachers being reprimanded. Do you think educators will line up to teach in Nova Scotia if these issues are not addressed? How do you think this will affect teachers staying in the profession, let alone staying in the province? How does your lack of funding to education in Nova Scotia help bring teachers here and make them want to stay? Right now, the teaching profession in Nova Scotia is unsustainable, and your budget does nothing to fix this issue that affects every single child and parent in Nova Scotia. We have children with complex needs who are not receiving the supports that they need. We have students who are falling through the cracks because of the overwhelming needs in their classrooms. How does your budget, with no increases to funding, plan to address these issues to make Nova Scotia a desirable place for anyone in the teaching profession to live? Much like the shortage of family doctors affecting many Nova Scotians, are we willing to wait until we have students without teachers before we acknowledge and address this crisis? I urge you to reconsider our education budget and prioritize the future of our province by investing in our educators and ultimately the prosperity of our children. Thank you.
Thank you, Peter. I will go to committee questions, starting with MLA Nickel.
Thank you, Peter. And for the last minute, like, what part of Cape Breton, per se?
I recently moved to City Mines, but I'm born and raised in North Sydney.
Okay, just to clarify. And I was wanting, I have friends who are teachers, and to your point of saying that they're overwhelmed, some of them are looking at saying, maybe I'll become a nurse now, and they're just in their 30s. So I understand that, and other teachers say they'll take anybody with a pulse. That's how desperate things are, like to have the staffing addressed. But also, I'm also hearing that the pandemic added an issue in the classroom, and I just wondered if you could speak to that as to getting the students back to pre-pandemic as far as their attention and engagement in the classroom.
Oh, Peter?
I apologize.
No problem.
As far as the issues that were brought about due to the pandemic, one major one is many of the schools do not have a ventilation system, and we're seeing students and teachers and staff becoming sick on a regular basis. COVID is still here; it's not gone. On top of flu season, on top of strep throat, on top of everything else, and that's just the physical aspect of the buildings. As far as where students were, for a number of years, we had interrupted education. We had at-home learning, which teachers were able to do what no other profession did, and that was maintain a quality level education while doing it from home. Many teachers are learning how to do this. So now, once we've come back to the classroom, there is the gaps that students had in their education, it's now larger. And we're now dealing with more and more issues that students have in getting them back up to grade level or to achieve at levels pre-pandemic. So the workload the workload has increased and the supports aren't enough.
Thank you, Peter. MLA DiCostanzo.
Thank you, Mr. Chair. And I appreciate what you just said, especially about the classrooms with so many students with ESL. I called it ESL, but English as second language. You really should come and see what's happening in my riding in Clayton Park West, and it is incredible how those teachers are dealing with what they have in their hand and the amazing education but the overcrowding. They have no classrooms. Every classroom is used for something. And those students, they need a special attention sometimes just to take them. They have no room to take them to deal with the issues. It is beyond imagination what the not that's happening in these schools. And we have added modular classrooms, and now we're adding portable classrooms, and not enough bathrooms, not enough library space, not enough any of that. So imagine the stress that is happening in the city. It is beyond, and I honestly see a lot of things are going to be in the media and the violence I'm hearing a lot as well in my riding, and I wonder how much of it is from the overcrowding and the short staff. I don't know where we're heading. I'm really scared and I love the schools in my riding, and I've been screaming and shouting for new schools. If we have that idea of doubling population, we should be planning for that, and space and staffing. And is there a question? The question is, what do you see as the numbers that we need for teachers, and what they're saying we need, or we have vacancies, but where do you see the future of that number?
Peter?
I should have talked to you beforehand. You could have wrote my speech, because everything you just said, I agree with wholeheartedly. As far as the numbers, right now, I would suggest take as many teachers as you can get, because I'm not joking about a shortage of teachers across North America. Teachers are leaving the profession in droves, and I don't blame them. Teachers who are newly trained, new graduates, we're seeing dropouts within 5 years of leaving the profession because it's unsustainable. And in order to help ease that workload, in order to help make it more sustainable, we need more resources. That's human resources. We need more teachers in classrooms. We need smaller class sizes to reach all those needs, and we need the space to do it.
MLA LeBlanc with 45 seconds.
Did you see a difference, a drop in support workers? So like speech language pathologists, counselors, psychologists in the schools when the Liberal government changed, I think it was they took them out of the union or changed the way that they are scheduled, like they work full year round. I forget exactly the thing, but did you see a drop? Did you see an exodus of those types of workers when that happened?
Peter?
I can't comment on exact numbers, but anecdotally, yes, I did see people leave. I am happy to say that the NSTU fought against that, the removal of those individuals from the NSTU, and we were awarded that they were back in. But we have specialists that could do far better financially if they were to leave the system. We have specialists with caseloads of 1,000 students. How does one individual meet the needs of 1,000 students? We have specialists who go into schools and who are unable to meet the needs of all these students that are on their caseloads. I wouldn't blame any for leaving this profession.
Time for questions has elapsed. I want to thank you, Mr. Landry, for coming in and presenting to us today. Appreciate your time this afternoon. Thank you. Okay. I'll make sure. That's that's our last presenter. So I will now look for a motion to close presentations. I will ask MLA Boudreau.
I'm hitting buttons there. I'm not trained well. So I just have a motion that presentations on Bill 419, the Financial Measures Act, now be concluded.
We have a motion on the floor. All those in favor, please say aye. Those opposed? Motion's carried. And we'll have a motion. Next motion will be MLA Boudreau.
Thank you, Chair. I move that Bill 419, the Financial Measures Act, be returned to the House with amendment.
Are there okay, sorry, I'll ask the question. All those in favor of this motion, please say aye. Those opposed? Hearing none. The question?
Schedule A was removed.
Yeah. Okay. All right. So motion has been carried. And it's now 1:33 p.m. and today's Law Amendment Committee has been adjourned. Thank you.